आसमां हमारा है और आंसू छुपने वाले हैं। डर बिल्कुल छुप हजारों ख्वाबों में हम गाएंगे इस रंगीन को खुशियां दिखाएंगे। हजारों ख्वाबों में हम गाएंगे मिलके एक बेहतर दिन हम पाएंगे। आसमान को छू लो तुम और छोड़ दो ये रोना धोना, कह दो तुम खुद से हरे चमकोगे चम 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 चम। आसमान को छू लो तुम और छोड़ दो ये रोना धोना, कह दो तुम खुद से हरे चमकोगे चम 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 चम। चम 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 चम। चमकोगे चम 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 चम। तुम और हम हैं साथी हमेशा, जरा सा धीरज हो तो ना होंगे परेशान। दुनिया जो कहे उसे कहने दो, अब साथ साथ इस प्यार को बहने दो। हजारों ख्वाबों में हम गाएंगे इस रंगीन। तो खुशियाँ दिखाएंगे हजारों ख्वाबों में हम गाएंगे मिलके एक हर दिन हम पाएंगे। सब कुछ खुद से हरदम चमकोगे चम 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 चम। आसमान को छू लो तुम और छोड़ दो ये रोना धोना, कह दो तुम खुद से हरदम चमकोगे चम 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 चम। चम 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 चम। चमकोगे चम 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 चम।
सुर में गाना सीखिए पाधानीसा ऐप के साथ AI पावर्ड पर्सनल म्यूजिक टीचर फ्रॉम सारेगामा।
I know you can, by the time I realized I have to check and the mic check, 1, 2, 3 is on. So hello parents, it will be nice if we take the plates outside because we are going to start, we should have started by now, but we're going to start very soon. So it was expected, but it has been pointed out that the food inside the hall is not allowed. If we can finish our food outside. Thank you so much. And I know we all are very, very attentive and vigilant about the rules and the regulations we posted for all of us. And we read them before coming here. Otherwise, if you ask me, I can go through them again. So it's just for all of the information for all of you. We had asked for the parents to volunteer and many of you have volunteered. So we are just going to tell you the names of the volunteers who will support you at the medical one-on-one consultant part, at the food area. When these person are going to point to you out something, please listen to them and try to follow. And on self-advocate session, who are the volunteers. So medical team support will be provided by Ms. Rashmi Anil Joshi, Ms. Roshni Parekh, Mr. Samik Mukherjee, Ms. Rashmi Agarwal, Mr. Santosh Lunkar, Ms. Deepti Mathur, Ms. Parveen Lata, Ms. Bhagyashri. And on food area, if you find these people or these parents pointing you out for something, please try and cope, because you'll find disciplining all of us, Mr. Santosh Lunkar, Ms. Priya Parveen Lata, Ranjita ma'am, Rashmi Agarwal, Mr. Anil Joshi, and Mr. Ranjan Maharana sir. And for self-advocate sessions, we have with us my friend Nupur Mehra, Preeti Jain, Rashmi Agarwal, Deepa Shivaji ma'am, Deepa Vishnu ma'am, Deepa Karthik Shivaji ma'am, and Priyanka Lunkar ma'am. So you can hand over your self-advocate to them. And let's be on time. If your friends are still not here in the hall, you can call up or just go out and nudge them to come here, take the seats. And before we begin our program, we are requesting you to take your kids from the stage, because once you are on stage, you don't feel like leaving it like me. So if we can settle them in the audience, it will be nice. And you all who are present here, you remember we provided you with a performer where you were supposed to fill in the medical details of your self-advocate. To those who have given good, those who have not, please carry it along with you in one-on-one consultation. All the medical practitioners sitting there or our panel of doctors will support you in filling it. Okay? So do not forget, if it is in the room, please go and fetch it before your one-on-one consultation. In the tea break or the lunch break, you can bring it and keep it with you. So you need to carry that performer. Please do carry it.
आसमां हमारा है और आंसू छुपने वालों के डर बिल्कुल झूठ है, चलो उड़ते हैं आशाओं के पंख से। आसमां हमारा है और आंसू छुपने वालों के डर बिल्कुल झूठ है, चलो उड़ते हैं आशाओं के पंख से। हजारों ख्वाबों में हम गाएंगे इस रंगीन को खुशियां दिखाएंगे। हजारों ख्वाबों में हम गाएंगे मिलके एक बेहतर दिन हम पाएंगे। आसमान को छू लो तुम और छोड़ दो ये रोना धोना, कह दो तुम खुद से हरे चमकोगे चम 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 चम। आसमान को छू लो तुम और छोड़ दो ये रोना धोना, कह दो तुम खुद से हरे चमकोगे चम 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 चम। चम 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 चम। चमकोगे चम 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 चम। तुम और हम हैं साथी हमेशा, जरा सा धीरज हो तो ना होंगे परेशान। दुनिया जो कहे उसे कहने दो, अब साथ साथ इस प्यार को बहने दो। हजारों ख्वाबों में हम गाएंगे, इस रंगीन दुनिया को खुशियां दिखाएंगे। हजारों ख्वाबों में हम गाएंगे, मिलके हर दिन हम पाएंगे। चमकोगे चम 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 चम, आसमान को छू लो तुम और छोड़ दो ये रोना धोना। कह दो तुम खुद से हरदम, चमकोगे चम 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 चम। चम 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 चम। चमकोगे चम 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 चम।
Good morning. जिन्होंने खाया हुआ है उनकी भी जबान नहीं निकल रही है। गुड मॉर्निंग दोस्तों, कैसे हैं आप? कैसी हैं आप इरा? ये इरा है हमारी झांसी की रानी, है ना। हिंदी में पोएट्री पढ़ती हैं ये, स्कूल में अपने, और काफी सारे अवार्ड्स लेके आई हैं, है ना। पूना में रह के हिंदी, वाह बढ़िया। बाहर जो भी दोस्त हैं हमारे ब्रेकफास्ट कर रहे हैं, आप सबसे अनुरोध है कृपया हॉल में आ जाएं।
आसमां हमारा है और आंसू छुपने वालों के, डर बिल्कुल झूठ है, चलो उड़ते हैं आशाओं के पंख से। आसमां हमारा है और आंसू
So today also we want to begin by expressing our gratitude to the ones who supported us to make this 8th edition of IIDSC a success. Yes, first and foremost, we want to express our gratitude to Mr. N. Ramachandran, Mr. Mahendra Agarwal sir, Shri Mahavir ji from Faroe Alloys, Manipal Hospital for being our medical partners, Kepler Healthcare, Dr. Sundar Raman and his family for tremendously supporting us, Ms. Deepa Vishnu, getting Fitbud programs for our self-advocates, our champion self-advocate Pranav Agarwal, Ms. Rashmi Agarwal and their family for giving the cross-body pouch you must have all received in your registration kit. We also want to thank many of our parents who supported us, didn't wanted us to take their names. So we really give a round of applause for them who didn't want it to be named from the stage, but there are few we force them that we are going to take your name. So we want to thank Mr. Amit Goel and the family and our champion Sanvi for providing the t-shirts you received for all of you. You took a lot of time to give your sizes, and it was very late to get it all printed and ready for you all. So next time, be on time when some information is asked from you. There's somebody is waiting to get it prepared for you. So thank you, Amit, Sanvi, and family for that. We want to thank IISc for providing us volunteers. We also want to mention Abir and Shikha and Pankaj Bhargava for giving us the most beautiful moisturizing cream for which we have got addicted now. So we also want to thank, last but most important, Dr. Varsha Jain for providing a self-advocate support for the theatre workshop. Can we hear it once for all our volunteers? Because we all know without their support, we wouldn't have been able to make it a success. Louder, yaar, you had your breakfast. So the बाहर वालों को पता होना चाहिए कि अंदर कुछ शुरू हो गया, so that they leave their plates and come inside. Yes, and a special mention for our talented chocolatiers, Aditya, Hemant, Kunal, and Vardhan from Chandigarh. We need to hear it for them because they took very, too much hard work and efforts they put in to create those chocolate boxes for our, the team of medical experts. So can we give it? Yeah, can we hear it for them? Thank you so much.
बहुत बहुत शुक्रिया समीक्षा। हमारे सहयोग करने वाले सभी साथियों का आपने हमें जानकारी दी, बताया, वो हमारे लिए बहुत महत्वपूर्ण है। उसके बिना तो ये संभव ही नहीं हो पाएगा। हर तरह की मदद की ज़रूरत होती है हर आयोजन में। जैसा कि आपको मालूम है, अभी हम मेडिकल से जुड़ी हुई बातों के ऊपर ये हमारा सेशन होने वाला है। इसकी आगे की जानकारियाँ क्या क्या इसमें हैं, कैसे हैं, वो सब समीक्षा आपको देगी, बताएगी। हमारे डॉक्टर्स हमारे साथ आ चुके हैं जो आपको जानकारियाँ भी देंगे अलग अलग कार्डियोलॉजी या फिर हर तरह के क्षेत्र की। और उसके बाद आपके सवालों का जो हाँ, अगर हमारे पास समय रहा तो हम हाँ लिख के हाँ नोट पैड पे आप अपना सवाल लिख के दे सकते हैं और हम उनसे पूछने की कोशिश करेंगे। अदरवाइज तो 1-on-1 सेशन में आप डॉक्टर से मिलेंगे ही। हमारे डॉक्टर्स जब हमारे साथ होते हैं तो हमें लगता है कि वो आए हैं और हमारी कुछ प्रॉब्लम्स खत्म होंगी, और उन्हें भी शायद ये लगता होगा कि उनकी वजह से हमारी कोई मदद हो रही है। पर असल में बात ये है कि वो आ रहे हैं और कुछ ना भी बोलें, उतने से भी हम ठीक हो जाते हैं। वो कहते हैं ना कि उनके देखे से जो आ जाती है मुंह पे रौनक, उनके देखे से जो आ जाती है मुंह पे रौनक, वो समझते हैं बीमार का हाल अच्छा है। तो अपने सब डॉक्टर्स का हम धन्यवाद करते हैं और बहुत शुक्रगुजार हमेशा रहते हैं उनके कि समय समय पर आकर वो हमें इस तरीके से समृद्ध करते हैं जानकारियों से। तो मुझे लगता है आज का ये सेशन अब हम शुरू करते हैं। समीक्षा। अच्छा, अभी थोड़ा सा और वेट कर लेते हैं, तो थोड़ी देर और आप लोगों को मुझे ही झेलना पड़ेगा। आज सुबह से जब से मैं यहाँ आई हूँ, आप में से जो लोग भी कल शाम राहुल के सेशन में थे, तो जब से मैं आई हूँ बहुत अच्छे फीडबैक मिल रहे हैं कि उन्होंने, जो लोगों के सवाल थे वो बहुत ऐसे थे कि जो हम लोगों के मन में आते हैं, जिस तरह के सवाल अपने बच्चों को लेके, अपने सिबलिंग्स को लेके, और अपने ये दो धारी तलवार है, दोनों बच्चों को पालना, तीनों बच्चों को पालना, इस तरह के एक स्पेशल बच्चे को एक बार आपको लगता है हम इसके लिए कुछ नहीं कर रहे हैं, तो आप उसके लिए करने भागते हैं, 5-6 महीने बाद पता चलता है नहीं उसके लिए भी कुछ करना था, तो हम उसके लिए चलते हैं, ये भी है। और फिर जब वो बच्चा बड़ा होता है तो उसकी शादी होने की बात आती है, तो भी हमारी बहुत सारी समस्याएं इस तरह की आती हैं। तो मुझे लगता है कि बहुत सारे सवालों के जवाब जो राहुल ने दिए हैं, लोग बहुत प्रभावित हैं, और मुझे लगता है एक नया फेवरेट जो है सिबलिंग्स का तो उभर के आ रहा है, राहुल को जिस तरीके से वो लोग देख रहे हैं एक रोल मॉडल की तरह। तो ये अच्छी बातें हैं कि बातचीत होती रहती है, तो बहुत कुछ उससे सीखने को भी मिलता है, और हमें एक राह मिलती है कि हमने अब आगे किस तरीके से लेके चलना है अपनी चीज़ों को। इस तरह की गैदरिंग्स का इनका मकसद भी यही होता है दोस्तों, कि हम अपना दिल खोलें और अपना दिमाग भी खोलें, जो चीज़ें हम जानने को मिल रही हैं उनमें से जो हमारे लिए फ़ायदेमंद हैं वो लेके, और हम आगे अपनी लाइफ को जितना बेहतर बना सकें। इसीलिए डाउन सिंड्रोम फेडरेशन ऑफ इंडिया की हमेशा ये कोशिश रहती है कि अपने पेरेंट्स के लिए और सबसे पहले अपने सेल्फ एडवोकेट्स के लिए एक ऐसी दुनिया ईजाद की जाए, जैसे कि रेखा माँ कहती है, जहाँ पे बस प्यार बांटते चलो, प्यार बांट।
We all are aware that our champions are achieving new heights every day, and every now and then, nowadays we are very connected, Hamsafar family, and we keep getting such encouraging news that how our champion self-advocates are, emerging in every platform and in every country and at our international level. Very recently, you all must have come across this champion self-advocate who believes that there is nothing down about it. She is Manasvi Ramakrishnan, and she has just graduated as a lawyer. And we are going to play a short video. Our technical team is working on how they can show you that video here on the screen. So there is a lot of encouragement and inspiration coming just drop all the expectation and start from where we are today. So once again, I request, please keep your self-advocates with you. We are going to have a very informating sessions coming up of our medical practitioners. So if you will keep your child with you, that will be very nice. And by 10, I think the self-advocates rooms will be open to receive your champion there. So if you keep them with you and brief them that where they are going to be and what kind of activities they are going to get involved, I think you will give them a small conditioning to be away from you and not be afraid. So soon we are setting up the stage for our medical panel today. And as we all are aware, and slowly, many of you are already half experts, knowing that what kind of underlying medical conditions this diagnosis brings in. And nothing to worry today. In today's time, we have a big Humsafar family parent support where we are there for each other. And we have a very, very empowered, a very, very powerful set of medical practitioners as a panel who have always been supporting us. Not a single face is new to you. I'm just going to read out who all are here. You must have met them in the corridors or walking around in the venue. So we have Dr. Pradeep with us as a geneticist. We have Dr. Preeti Singh Rekhiji. You have heard him before many times speaking on visions problems. We have our beautiful, renowned pediatrician from Chennai, Dr. Priya Biswa Kumar with us, who's going to moderate our medical intervention session. We have Dr. Jayashri Gopal, the endocrinologist, who is going to speak to you on one-on-one and here on stage also all about the thyroid issue and other aspects of endocrinology. We have our friendly doctor with us, a dentist doctor with us, who is friends with our champion advocates and always insist in taking the dental hygiene as a topmost priority, Dr. Nidhi Gupta. We have Dr. R. Sankar Sir with us, who is going to talk about all the orthopedic issues we come across. We have the Dr. N. Rangarajan Sir with us, who is going to address the mental health issues. We have Dr. Shankar Raman, who is going to come virtual with us for all the gastrointestinal issues. And from the host state, we have got support from a pulmonologist, Dr. Sandeep Jain sir. He is already with us here. So, and we also have from the host city, ENT support from Dr. Ramunaj Sinha sir. So, most of our, I think everybody from our panel is here. So, we really appreciate that you can sound your friends, fellow Humsafars who are not in the room, that they should respect the time of all of them. All of them are of international repute and have very busy OPDs and their hospitals and clinics. So they have left everything to be with you all here, give their time and precious advice and guidance to you. Some of you already have interacted with them, so need not to say much about them. So in the respect of their time and efforts, we should make effort to be here on time. We have already exceeded the time to start. Yes. Can we hear it for panel, please? Yes. So now you can see this small, beautiful champion with me, who is giving me a lot of, courage to stand here and speak on mic. Thank you, Dhriti, for giving me that support. And I'm going to hold your hand, don't worry, because you are giving me that courage to speak here. So I should not be leaving your hand when you are there. You are very courageous already, I know. So we have our champion here, Dhriti Ranka. Can we hear it for her? Yay. So now we request Dhriti come here on podium and speak, share what she wants to share.
When you believe in yourself, there's nothing you can't do. This quote from by Princess Kia is one of my favorite quotes from Princess Power. Hi, mine. It makes me think a lot about how important self-belief is. Hi, my name is Kriti. I am 12 years old. I love art and gymnastics, and one day I want to be both a famous artist and a gymnast. But before I talk about my dreams, I want to tell something about my journey towards self-love. When I was born, I had 2 holes in my heart, and now I have a pacemaker that helps my heart. But doesn't mean I don't have dreams. But yet I need to work a little harder and believe in myself even more. Self-love means accepting yourself just the way you are. I believe that God is in each of us, and that makes us perfect in our own way. When you start believe that, you feel stronger and happier. For me, it's about my own journey, whether it's your art or gymnastics or just being a good friend. It is also about being kind to myself when things don't go as planned. My dream is to become a famous artist and a gymnast. But no matter what happens, I know being myself is the most important thing. Like Princess B says in Princess Power, you can be anything. And the best thing is to be yourself. Thank you.
मेरी दोस्त इमोशनल हो गई है इस प्यारी सी बच्ची को सुन के। और आप देख रहे होंगे कि कितना उत्साह है जिंदगी को और अपने आप को प्रेजेंट करने के लिए, और कितना कॉन्फिडेंट है उसमें। तो बहुत प्यारी सी बच्ची के लिए एक बार फिर से जोरदार तालियां हो जाएं। हमारे बच्चे जब कुछ भी अचीव करते हैं तो बड़ी खुशी होती है, और हमें एक उम्मीद जगती है कि हाँ, अभी तो बहुत कुछ है जो वो कर सकते हैं।
Thank you so much, Dhriti. I just realized how much courage I lack in my life. It was not easy to hold the hand of this courageous girl. And I will try to be myself every time. Can we hear it one more time for her? So for self-advocate sessions, we have Hall OM 1 and OM 4. That is for IAC sessions. OM 2, Hall OM 2 is for Esther ma'am session. You all know what these sessions are. We have talked in length about these. OM 3 for those who have been enrolled for theater sessions. There was a limit, so I hope those self-advocates have reached there. So, so we will be inviting a medical panel to the on stage to take their seats, and taaliyan rukni nahi chahiye. So we invite Dr. Pradeep to take his seat. We request Dr. Ramanuj Sinha sir. He'll join us very soon. Dr. Preeti Rekhi sir on stage. Dr. Priya Bispuma ma'am. Dr. B. Harapriya. Dr. Jayashree Gopal ma'am. Dr. Nidhi Gupta ma'am. Dr. R. Shankar sir. Dr. N. Rangarajan sir. Dr. Sandeep Jain sir and Dr. Shankar Raman will join us virtually. To be with, अरे क्या हो गया breakfast अच्छे से क्या? I saw the plate you were filling. Come on. You know, each one of them is getting such vast experiences with our champions, and it is because of them we are achieving a lot of things in our life. तालियां रुकनी इतनी नहीं चाहिए. Come on. And you will get to hear them in English, and some of them you are very versed that they can translate in Hindi also. But we have my friend Parul here who will be giving you the glimpses of their talk in Hindi. So for moderating this session, we call upon Dr. Priya Biskumar ma'am.
Very good morning to all of you. Gives me great pleasure to kickstart this session. We have a very eminent panel of specialists here. We'll go through some snippets of what normally worries us in relation to each of their specialities. We know that when a child is born with DS, there are a host of things that can affect various organ systems. So in relation to that, some can present at that time, some can present later. When we go to a busy OP, when we see a pediatrician or any of the specialists, we may not have the time, they may not have the time to address all our queries. So this is your opportunity. Many of you have sent in your queries. We're having this panel here, plus even Dr. Shankar Raman, who's in UK, who will also be joining us. So we're all very eager to address all your issues. Just a quick round of introduction. So I'll start with the ladies. Dr. Nidhi Gupta. She's okay, I think they'll just introduce themselves, I think. Yeah, Nidhi, come. Start with Nidhi first.
So I'm more than a professional, more than a caregiver. I'm a mother of a child with Down syndrome. Most of you must have missed her, Ashi. Her name is Ashi. She's 13 years old, going to be 14. And I think after she came in my life, I knew the real meaning of being a caregiver. Before that, I was a hardcore professional, and I mean, there was a clear-cut distinction between a patient and a doctor, but after that, those boundaries just disappear. So working proactively for our kids and for kids with special needs from various kinds like autism. But this platform is obviously special thanks to DSFI, Rekhama, and all the parents who are supporting the cause, who are supporting and helping all the professionals like us to evolve and be better day by day. Thank you.
Dr. Jayashree Gopal, she's a consultant endocrinologist from Chennai. She's the vice president of the Endocrine Association of Tamil Nadu and India. She's very well known to all of us. She holds a special place and she's been working with the Federation for many, many years. Thank you, Dr. Jayashree. Dr. Harapriya is a pediatric, could you stand up, Harapriya? She's a pediatric endocrinologist. She's a consultant, pediatric cardiologist from Mayotte Hospitals. She has a small NGO which works very actively in treating children with congenital heart diseases. Thank you, Harapriya, for being with us. Dr. Pradeep, he's a consultant geneticist and pediatrician from Coimbatore. He's been working with us for many years. He has many workshops and works very actively in promoting awareness and does a lot of programs in Coimbatore. He's been with us in all our DSFI programs and the IIDSC. Thank you, Dr. Pradeep. Dr. Sandeep Jain is a pulmonologist from here, from Kolkata itself. He's an interventional pulmonologist from the Tata Cancer and Narayana and Bellevue Hospital. So he's going to try and address all our issues in relation to this. Thank you, Dr. Sandeep, for taking time. He said he has to leave early, so whatever questions in relation to that, we'll try and do earlier. Dr. Reiki, he needs no introduction. He's been with us for so many years, and I'm sure most of our children have met him. He's a consultant optometrist. He runs this Spectrum Eye Care, and children just love going to him. Thank you, Dr. Reiki, for being with us. Dr. Shankar, he's a consultant pediatric orthopedic surgeon who's been practicing at Apollo hospitals for more than 25 years. He was in Ireland initially. He works with us through all our programs, and he's a big support. And all your orthopedic issues, I'm sure he will be able to address. Thank you. Dr. Rangarajan, of course, needs no introduction. He's a consultant psychiatrist. And I think one of the most underreported and undertreated issues, mental health. And he's one of the most famous psychiatrists in India. And he has helped a lot of our children. So do feel free to reach out. Thank you all for being part of this. So first, we'll start with an orthopedic problem. We're just going to throw questions around so that it's not monotonous. So this is a question from some of the audiences. My baby's leg is a little twisted while walking. Is there any shoes for the legs to keep it straight? So I want to know, when a child is born with DS, when do we actually need to bring them for an orthopedic evaluation? Is it necessary for all children with DS to come and see you, or only if they have issues? What are the problems that we need to anticipate in the early stages and maybe toddlers and early childhood?
So the difference between children with the Down syndrome and other kids are, there is going to be a developmental delay that we have to accept it. In a normal child, if the child is going to stand up and walk at the age of 1 year, in a child with the Down syndrome, it is going to be delayed 2 years, 2.5 years, or up to 3 years. If there is any further delay beyond 3 years, then we have to think about there is some issue. Then it's better to get an opinion from the pediatrician Accordingly, you can get a further medical opinion. This has to be translated, or then I can add on.
सवाल था कि बच्चा पैरों को मोड़कर चलता है, तो उसको कैसे सही किया जा सकता है। तो डॉक्टर ने जवाब दिया है कि दूसरे बच्चों में और हमारे बच्चों में एक अलग किस्म का अंतर होता है जिसे हमें समझना होगा। और वो 3 साल की उम्र तक अगर नहीं उस पेस पर जा पाती हैं जिस पर एक डाउन सिंड्रोम ब्लेस्ड बच्चे को जाना चाहिए, तो तब हमें सोचना चाहिए।
Children with the leg twisted, like each one will have a different patterns of the way we walk. Some children will have a in-toeing, some children will have a out-toeing, some children will have a bow legs, some children will have a knock knees. There are up to certain amount we consider physiological if it's symmetrical on both sides. But sometimes this in-toeing is mainly because of child sitting in a W position or sitting on their leg. It makes it more, so the correction is not going to help if they're continually sitting like that. In-toeing can happen if there is a problem in the hip, problem in the leg, or problem in the feet. So just giving a shoe alone to correct the in-toeing will not help.
अलग अलग पैरों की अवस्था होती है। कई बार वो उसी की वजह से कई बार पैरों को मोड़ कर बैठते हैं, कई बार चलने में उन्हें अलग तरीके से चलते हैं, लेकिन वो सिर्फ पैरों को सीधा करने के लिए, सिर्फ टखनों के लिए कोई चीज को जोड़ने की आवश्यकता नहीं होती। हिप के मूवमेंट्स के लिए और हिप की पोजीशन के लिए और हिप की कैसी स्थिति है उसे भी देखना होगा और उसे वहां से सही करना होगा।
So we know problem is due to ligamentous laxity and hypotonia. Children coming with the late walkers, like after 3 years or 4 years, will need to be addressed, initially seen by a pediatrician. But when the child becomes a little bit old, they can develop a problem with the feet, knee, spine, hip, and the neck, depending upon their activities. So based on that, we have to go and see a doctor. Regarding each problem, we'll discuss later when we have one-on-one discussion.
Thank you, Dr. Shankar.
हाइपोटोनिया की वजह से उम्र बढ़ने के साथ साथ हमारे बच्चों में अलग अलग कभी कंधे में, कभी गर्दन में या पैरों में अलग अलग प्रॉब्लम्स आती हैं। वो उनकी एक्टिविटी के बेस पर कि वो किस तरह की एक्टिविटीज अपनी दिनचर्या में करते हैं। इन सब पर और ज़्यादा डिटेल में बातें वो 1-to-1 सेशन में करेंगे।
Yeah, the next question to Dr. Sandeep. When many children come to us, the commonest problems usually recurrent respiratory infections. So what is your view? Why do these children keep getting recurrent respiratory infection? Is there an anatomical issue that leads to it? What is it that parents can do, to treatment? Of course, we all know there's a lot of viral and antiviral antibiotics. How does a parent look after? How do we prevent recurrent respiratory infections? Why does it occur? Can you please enlighten us?
Will it be okay if I answer in Hindi or English? Which one will be comfortable?
I think you can answer in both, mix of both, so that everybody can understand.
So, see, children with Down syndrome, like sir mentioned about hypotonia, there are other craniofacial abnormalities as well. So the mucociliary clearance.
I think you can do it in Hindi if you are able to.
Okay. तो डाउन सिंड्रोम के बच्चों को वयस्कों को भी चेहरे में कुछ उनका गठन अलग सा होता है, नॉर्मल लोगों जैसा नहीं होता। तो जो रेस्पिरेटरी सिस्टम की जो एक नॉर्मल तरीका है अंदर से म्यूकस को निकालने का, वो किसी हद तक कॉम्प्रोमाइज्ड होता है, जिसके चलते, और उनके सर ने कहा हाइपोटोनिया के बारे में, तो मसल टोन भी कम होता है, इंक्लूडिंग एब्डोमिनल मसल्स, रेस्पिरेटरी मसल्स। तो अंदर से म्यूकस निकलने की प्रक्रिया सही नहीं होती, जिसके चलते म्यूकस रिटेंशन का चांसेस ज़्यादा होता है। नाउ पीडियाट्रिशियन के पास आप सभी जाते हो तो रेगुलर इम्यूनाइजेशन आपको मिलता रहता है। दूसरे बच्चों की तरह डाउन सिंड्रोम के बच्चों को भी वायरल इन्फेक्शंस होने का चांस ज़्यादा होता है, तो आप इन्फ्लुएंजा वैक्सीन, रेस्पिरेटरी सिंसाइटल और न्यूमोकोकल वैक्सीनेशन लगाते हो। बट इश्यू होता है जब बच्चे का एज 12 क्रॉस कर जाता है, फिर आप एडल्ट डॉक्टर्स को दिखाना शुरू करते हो और हमारा थ्रेशोल्ड वैक्सीनेशन के लिए बहुत हाई होता है। तो वेरी कॉमनली हम लोग मिस कर जाते हैं ईयरली इन्फ्लुएंजा वैक्सीन बच्चों पे। जो न्यूमोकोकल वैक्सीन लगाना है वो भी मिस होता है। सेकेंड न्यूमोकोकल वैक्सीन के साथ जो प्रॉब्लम आता है कि हम सिर्फ पॉलीसेकेराइड वैक्सीन लगाते हैं, कंजुगेट वैक्सीन जो एक बहुत आवश्यक है वो मिस हो जाता है। तो आप अपने डॉक्टर से मिलते रहें और रेगुलर इम्यूनाइजेशन के हिसाब से कराते रहें इम्यूनाइजेशन। रिकरेंट इन्फेक्शन से बचने के लिए कोविड के टाइम पे हमने देखा कि किस तरह से वायरस से लड़ा जा सकता है। दवाइयाँ उतनी काम नहीं करती थी जितना प्रिवेंशन काम करता था। तो एक प्रिवेंशन है वैक्सीन, सेकंड है हाइजीन। तो जब भी किसी भी वायरल इन्फेक्शन की महामारी चल रही हो, लाइक अभी इन्फ्लुएंजा एपिडेमिक चल रहा है, तो जो कुछ भी हाइजीन के मेजर्स आप ले सकते हो, लाइक मास्क पहनना, सिर्फ बच्चों को नहीं बाकी घर वाले भी, रेगुलर हाथ धोना, इनसे भी आप बहुत हद तक बच सकते हो। इन्फेक्शन होने के बाद दूसरे बच्चों में और वयस्कों में हम सभी इनिशियली घर में ही पैरासीटामोल का कोर्स करते हैं या नॉर्मल दवाइयाँ देकर वेट करते हैं। बट क्योंकि अधिकतर डाउन सिंड्रोम के बच्चों के रेस्पिरेटरी सिस्टम कॉम्प्रोमाइज्ड हैं, आइदर रेस्पिरेटरी प्रॉपर या सेकेंडरी टू कार्डियक डिजीज या दूसरे कारण से, तो बच्चों को कभी भी कुछ हो तो देरी ना करें, जल्दी से जल्दी अपने पीडियाट्रिशियन या जो भी आपके फिजिशियन हैं उनसे मिलें, क्योंकि ज़रूरत पड़े तो एप्रोप्रिएट एंटीमाइक्रोबियल आपको शुरू करेंगे।
Thank you. Another important thing is good nutrition. He did speak about hygiene and how to prevent. So the vaccinations, I think make sure you do all the primary vaccinations. Most important is the pneumococcal during the primary vaccinations and the booster. If you have missed the pneumococcal in the initial, make sure you definitely give it at least later, and an influenza vaccination every year because the strains keep changing and it is given at different times based on where you live in India. But just when the monsoon is starting, it's important to give the influenza vaccination. So since he spoke about cardiac defects, let me ask Dr. Haripriya. Are cardiac defects very common in children with Downs? Why do you think this happens? Do all children have to have an echo when they are born? Should they have it frequently?
Okay. As far
सुनील कुमार गोगी जी, आपका बच्चा बाहर अकेला घूम रहा है और आपका फोन नहीं लग रहा है। प्लीज अगर किसी के पास उनका फोन नंबर हो या आप सुन रहे हो तो प्लीज उसे एक बार कलेक्ट कर लें। थैंक यू।
No problem. Okay. When we talk about children with Down syndrome, around 30 to 40% of them have associated cardiac defects. Any cardiac defect in any population actually has a genetic basis, and specifically when we look at Down syndrome, there's a chromosomal defect is the common association rather than the cause. So since 30-40% of them are known to have heart defects which needs to be corrected early in infancy, it is important that they have an echo immediately after birth.
Okay, so when a baby is born, you have to do an echo to make sure that you have ruled out. You can't pick up all defects by just listening with the stethoscope. So an echo is important. So suppose a child has been diagnosed with a cardiac defect, say a VSD or an ASD or something. How frequent should the follow-up be with the cardiologist?
Yeah, once the echo is done, the cardiologist will be able to assess the severity of the situation. That is how big the shunt is, how is the lung pressure, like not just the size of the defect, how much blood it is shunting, how much it is affecting the lung blood flow and the pressures. So all these things determine how early we should operate on these children. Essentially, Down syndrome children themselves have an innate predisposition to have higher lung pressures. So even at the first instance when they meet the doctor, they will always be in that category where the lung pressures are really high, which in turn makes them quite a high risk for surgery. But then it is also true that unless we treat the heart disease, the lung pressure is not going to come down. And we also need to take care of other factors which contribute to the high lung pressure. Like many of them have upper airway issues, adenoids, tonsils, like such kind of, the narrow airway, the air passages. So we need to take care of all those aspects before we actually address the surgery. And the checkup and follow, once they have a small defect which is not very significant, they maybe have to have a follow-up, once in 6 months or once a year. But once they are diagnosed to have a significant heart defect, they need to be advised having early surgery.
So 1 in 2 or about 30 to 40% is nearly 1 in 3 children may have a cardiac defect, as she said. So the important thing is when there is a cardiac defect, if it is not very, doesn't require surgery, make sure you do regular follow-ups and treat respiratory infections aggressively. Don't just leave it because it can worsen because of the defect. Thank you. Now to Jayashri. I think just like cardiac defects, I think endocrine problems are also very, very rampant in children. So when should the first value be done of a TSH? What is a hormone? What is this thyroid hormone? I know you've given us a booklet, but can you throw some light on this?
Sure.
Yeah.
Good morning, everyone. अब सबको वो बुक मिला, थायराइड का बुक नहीं मिला तो ले लेना, एक बुकलेट है, छोटा सा बुकलेट. I've just listed out a lot of the things related to the thyroid and that. So thyroid is a gland. यहाँ पे एक butterfly shaped gland हम कहते हैं, उससे thyroid hormone बनता है. And thyroid hormone is needed for normal working for every cell in our body. From your hair to your skin to your heart, lung, जो भी डॉक्टर ने बात किया, joint, bone, सभी के लिए थायराइड का लेवल नॉर्मल होना चाहिए, वो ठीक से काम करने के लिए और ठीक से डेवलपमेंट होने के लिए. जैसे डॉक्टर प्रिया ने बोला, इट इज़ वेरी कॉमन डाउन सिंड्रोम में ऑलमोस्ट 40-50% ऑफ चिल्ड्रन डेवलप अ थायराइड प्रॉब्लम बाय द टाइम दे आर 18 years old. एंड क्यों इतना ज़रूरी है थायराइड को बर्थ के चेक करने के लिए? क्योंकि थायराइड इज़ वेरी वेरी इंपॉर्टेंट फॉर ग्रोथ. जो बेबी का हाइट ज़्यादा होता है, बेबी का मस्कुलर डेवलपमेंट होता है, वो सबके लिए थायराइड बहुत ज़रूरी है. तो इसी के लिए, और थायराइड को हमको ब्लड टेस्ट के बिना तो पता नहीं चलेगा कि थायराइड का प्रॉब्लम है या नहीं, पता नहीं चलेगा. तो इसी के वजह से बहुत ज़रूरी है सभी बच्चों को बर्थ के समय में थायराइड का ब्लड टेस्ट करने के लिए. और वो ब्लड टेस्ट देख के आपका डॉक्टर ने डिसाइड करेगा थायराइड का सचमुच प्रॉब्लम है या नहीं, डिसाइड करके. और उसका ट्रीटमेंट बहुत आसान है. एक थायराइड का दवा तो लेना चाहिए, और टैबलेट लेने से तो थायराइड का लेवल मेंटेन होने से थायराइड के वजह से जो भी तकलीफ होता है वो ठीक हो जाता है. उसमें तो सर्जरी ऐसा कोई कुछ करने का ज़रूरत नहीं है, सिर्फ एक दवा लेने का. बट व्हाट इज इम्पॉर्टेंट इज every 6 months at birth and every 6 months at least up to the age of 3 or 4 years टेस्ट करने के लिए. उसके बाद तो साल में एक बार, अगर थायराइड का प्रॉब्लम नहीं है तो साल में एक बार करना जरूरी है.
Thank you. So the take home message for that is definitely check the TSH and the free T3, T4 levels till 4 years of age. This is because most of the brain and the myelination, what we say is the nervous system development, happens by 4 years. This is why every 6 months is important. After that, a yearly checkup is necessary. If you see a normal thyroid value, please do not stop the medicine. It means it is normal because of the medication. So never stop medication without consulting your endocrinologist or your pediatrician. Next is to Dr. Rangarajan. Most of the times we tend to neglect mental health. We concentrate only on physical health. So what are the problems that you encounter in children with DS, like temper tantrums, anxiety? How do we handle these?
Yeah, mental health problems for any child, apart from what happens because of some basic brain problems, developmental problems, if you take any child, there are two important reasons why a child has a mental health problem. And teacher. So these are the two important reasons why they have problems. So we need to work with parents and teachers and make them understand that each of these children are capable of thinking, doing things, but they also need to be given some guidelines as to how not to behave, which is better behavior, and what way their behavior can be problematic. I mean, this is a learning which every teacher and parent should first of all get inside. And also understand at each stage of development, you need to deal with a child in a different way. You have a very, very small child who, say, throws a tantrum rolling on the floor. let's say less than 5 or 6 years of age. Now, you don't get rough with the child. You actually carry the child, do the typical show the bird, show the moon, show some monkey face, distract the child, and generally the child's tantrum will come down. Do not immediately give what the child wants to handle the tantrum. That's the idea. Well, sometimes the child might be asking for something which is very correct and valid. So understand if that is the right thing. Okay, now if the child grows a bit older, then you need to be firm and say, even if you're asking for the right thing, if you're asking for in the wrong way, you will not get it. So that is the difference. I think I'm putting it in a very broad perspective. There are lots more very subtle things. But at some point, you tell the child, no, you are not going to get anything because you're rolling on the floor. If you want something, ask properly. If it is right, you will get it. If it is not right, you will not get it. But the child has to grow up to a level to understand that. Be firm. Don't take the easy way out by saying, okay, fine, you give the child will stop crying, I can go on with my work. Don't do that. Now that creates, quote unquote, a huge monster in your family as the child grows up older and older.
So you
Doctor
have to be
कहते हैं-
firm with your children. Yeah, please go on.
डॉक्टर कहते हैं कि दिमागी स्वास्थ्य की समस्या पेरेंट्स और टीचर की वजह से दो मुख्य कारण हैं जिनकी वजह से ये आती है, और इन दो से ही सबसे पहले बात करनी पड़ेगी, पेरेंट्स और टीचर से, कि उनका व्यवहार कैसा होना चाहिए बच्चे के साथ, और बच्चे के व्यवहार के जवाब में वो किस तरह का व्यवहार करते हैं, ये महत्वपूर्ण है। अगर बच्चा छोटी उम्र का है और टेंट्रम थ्रो कर रहा है, किसी तरह से अपनी डिस्कम्फर्ट दर्ज करा रहा है या आपको किसी भी चीज़ को मांग रहा है, तो आपको उसे कहते ही एकदम नहीं दे देना है। अगर आप उसे तभी पूरा कर देंगे तो वो फिर उसी तरह से चीज़ें करेगा। तो ये ज़रूरी नहीं है कि आप उसे उसी समय पूरा करें। अगर वो सही भी चीज़ मांग रहा है तो आपको उसे ये समझाना पड़ेगा कि आप सही चीज़ को भी गलत तरीके से नहीं मांग सकते हैं। बड़ा होने पर भी आपको थोड़ा एक सख्त रहना पड़ेगा अपने बच्चे के साथ, और इन्हीं से उसका व्यक्तित्व बनेगा जो बड़े होकर उसके काम आए। थैंक यू।
So next to Dr. Pradeep. Is there any genetic treatment to reduce the effects of the developmental delay that we see in Down syndrome? Is there anything available? What about any stem cell therapy? What are your takes on this?
So now the genes have gone inside. All the extra genes with that particular chromosome, the 21 and trisomy, third chromosome has gone inside all these cells, the trillions of cells. There's no way we can get out these cells from these genes from the cells. So what we are seeing as the manifestations at the organ level. So there are extra genes inside these cells, and these cells are the building blocks of the organs. So the functions of the cells are reduced so that the organ function is also coming down. So we cannot go take out these genes outside. So there are no gene therapies or chromosomal remedies or even stem cell transfusions are not going to work for this particular disorder. Maybe gene therapies are there for few single gene disorders not related to chromosomal disorders like Down syndrome as of now.
So this is very important to know, because we have all these WhatsApp universities which keep saying, the stem cell therapy is there. So people tend to, believe all kinds of things and think there is some new therapy which has evolved. Right now, there is no new stem cell therapy for Down syndrome. It's very important to understand this.
हाँ, गुणसूत्र या क्रोमोसोम जो एक सेल में है, जो एक कोशिका में है, वो जा चुके हैं, आप उन्हें नहीं बदल सकते, और वो सेल उसी तरीके से व्यवहार करेगी जो गुणसूत्र उसके पास है। यानी कि वो बच्चा या उसका शरीर का वो अंग उसी तरीके से व्यवहार करेगा, उसे बदला नहीं जा सकता। हाँ, सेल थेरेपी है, बहुत सारी चीज़ों के लिए है, लेकिन इसमें वो किसी भी तरीके से काम नहीं करेगी।
So, Dr. Reiki, when should a child be first brought to you for any kind of vision assessment? What is the minimum age in a newborn or a, infant or an older child? When should they first be found? And how do we know by looking at our child and its activities whether there is a visual problem?
Namaskar. I'll try and speak in Hindi. So, सबसे पहले जब बच्चा पैदा होता है, आंखों के हिसाब से हमें उसको जितना जल्दी देख सकते हैं पहली बारी, वो ज़्यादा अच्छा रहता है हमारे लिए, क्योंकि 2-3 फंक्शन 4 हफ्ते के अंदर डेवलप होते हैं और थोड़े फंक्शन 6 महीने के अंदर डेवलप होते हैं। तो जितना जल्दी हो सके पहली बारी हमें देखना चाहिए। दूसरा है, एक बारी देख लिया है, उसके बाद 6 महीने में एक बारी देखना चाहिए। उसके बाद हर साल 2.5 years एक क्रिटिकल एज होता है जिसके पहले एक कंप्लीट चेकअप होना चाहिए। उसके बाद में हर साल या 1.5 साल में, डिपेंडिंग ऑन अगर कुछ प्रॉब्लम है या नहीं है, तो कभी कभी 4 महीने में देखते हैं, कभी 6 महीने में, बट 6th month इम्पॉर्टेंट है, 2.5 years इम्पॉर्टेंट होता है। तो हमारे बच्चों में लगभग अगर आप देखो 66-70% आंखों की कुछ ना कुछ प्रॉब्लम होती है, जैसे लिड प्रॉब्लम्स होती है, मोतिया होता है, केराटोकोनस होता है, 3-4 चीजें काफी इंपॉर्टेंट होती जो आती है। तो जो हमारे बच्चे होते हैं, हमें ये खुश नहीं होना चाहिए कि वो सब कुछ देख रहे हैं, चिड़िया नजर आ रही है, एयरप्लेन नजर आ रहा है। इसका मतलब ये नहीं कि आंखें की नजर दोनों आंखों में एक ही है। तो एक बहुत सिंपल टेस्ट है जो आप हर बच्चे में कर सकते हैं। मानो वो अगर टीवी देख रहा है, तो एक आंख की नजर बोलो 80% है, दूसरी आंख की नजर 50% है। अभी दोनों आंखों से तो उसको 80% नजर आ रहा है, तो मानो इस आंख में 80% है। तो अगर मैंने ये आंख के सामने एक हाथ लगा दिया तो बच्चा टीवी देखता रहेगा। अगर मैंने इस आंख के सामने हाथ रखा तो नजर 80 से 50% हो जाती है। तो ये 3 महीने का बच्चा भी ये करेगा कि अगर आपने ये किया, बच्चा ऐसा करेगा। ये बहुत सिंपल टेस्ट है, आप घर में कर सकते हो। तो इससे हमें मालूम होता है कि एक आंख की नजर दूसरी आंख की नजर से ज्यादा है। और ये जो इसको सही करने के जो तरीके होते हैं, ये 2.5 years से पहले हमें शुरू करना पड़ता है। उसके बाद में कभी कभी होता है 17 साल की उम्र में भी हम इम्प्रूवमेंट कर सकते हैं, बट इसका जो प्रोबेबिलिटी होती है उसकी इम्प्रूवमेंट की कम होती जाती है। इसको हम लेजी आई बोलते हैं। आंख में कुछ खराबी नहीं है, सिर्फ थोड़ा सा ट्रीटमेंट देना है जिसके कारण वो नजर आंख ठीक हो जाए।
Thank you. I hope that was clear. We have with us Dr. Shankar Raman, who's joined us from Birmingham. He's Dr. Shankar Raman. Good morning to you. I think it must be very early for you. He's the Director of Medical Education at George Eliot Hospital in Warwickshire in England. He's the clinical lead for gastroenterology and GI cancers for North Warwickshire. He has the award of Executive Healthcare Leadership from the NHS Leadership Academy. Thank you for joining us. He's going to address all the gastroenterology related, like the stomach and intestinal problems that can happen in our children. So, Dr. Shankar, what are the gastrointestinal issues that we can expect in children with Downs?
Thank you, Priya, and thank you for having me in this conference. And thank you again to Rekha Ma for inviting me for this. A great pleasure to actually join all of you and share whatever little I can with this audience. There can be a number of issues with Down's syndrome in the GI tract, starting from the mouth right down to the bottom end. What we need to do is understand what is happening so that we can help people better. So what I would say to everyone is, fikr mat karo, hum hain aapke saath, we'll get through all this together. So the first issue that we normally tend to see is what we call a reflux, which is where there's food or acid or water coming up via the mouth. when people are, then children or babies are actually eating food. This can happen due to a variety of reasons. Again, if it happens in infancy when they're just born, they will need to get this immediately checked out, because it could be that there is a blockage there. So if you do find that babies are having problems with vomiting or not eating at all in the first few days or first couple of weeks of life, please get this checked, because this is something which has to be corrected. So you will need to kind of address this by taking the baby to a doctor and getting that checked out. There can be other issues as it progresses. There could be issues with constipation, which again is quite a common issue in Down syndrome. There could be issues which are related to that due to kind of an underactive thyroid, which I think one of your August panel members is an expert with, Dr. Jayashree Gopal. She can advise you with that. But again, these are all correctable issues, and that is what we all need to understand, and that is what all the parents need to understand, that these are correctable issues. One common thing which may have not be recognized as much is a condition called celiac disease, which affects nearly 1 in 6 children with Down syndrome. And this is a condition where there is an intolerance to products containing wheat. And that can actually lead to issues with diarrhea. It can lead to constipation. It can lead to a failure to thrive, that is a failure to gain weight. It can lead to irritability, just irritability with children, because that may be the main manifestation. The main presentation could be irritability with the children. It could be tiredness. It could be malaise. It could be anemia. So lots of ways that can present. And so that is something which is important to look out for. If the baby or the child is not thriving or is not actually developing or gaining weight as much as you think they should, please think about this, or at least ask the doctor to think about this, because this can be tested. It is a simple blood test that can be done to kind of screen for it. If there is a high index of suspicion of the condition, then other tests can be done as well to confirm the diagnosis. But the main thing is to think about this. So as I said, 1 in 6 children with Down syndrome can have celiac disease. And I would recommend, if this is not done already, that between the ages of 2 and 3 at least, all children with Down syndrome should be screened for celiac disease. This is would be my kind of suggestion and recommendation to the Down Syndrome Association of India, to make sure this advice is kind of publicized widely on the website for the children for India, and for especially obviously for parents of the children in India. So this is just a brief overview of some of the issues. And I haven't gone into too much of detail, because obviously it all depends on the specific condition and the specific issue that that particular child is facing, or the parent might be worried about. So I'm very happy to kind of take any questions that people may have with regard to any of this.
So if there is any kind of bloating in your child, or the child is not gaining weight adequately, or is having constipation, like Dr. Shankar said, it is important to rule out this condition called celiac disease. So you can talk to your pediatrician or your pediatric gastroenterologist after you have been referred. So for this, what do you think is the dietary management other than medication? What would you recommend, Dr. Shankar?
If there is a suspicion of celiac disease, and if there is a confirmation from, say, a blood test, the main treatment for this condition is avoidance of wheat in the diet. So wheat is in the form of any kind of rotis, bread, any kind of wheat in the diet should be excluded, and that is where the treatment is. That is the mainstay of treatment, really. There is no kind of medication for this condition. This is about a diet modification and kind of treatment. And the advantage with this is it is completely reversible with simply changing the diet to avoid wheat. And that is what people don't understand, that there a lot of people come to me to say, oh, do we need to kind of have any medication on top of this? Do we need to take any tablets? You don't need to take tablets. It is just about managing the diet. And this is where we refer all our patients with celiac disease to the dietitian, to the nutrition team, who give them more detailed advice. And that is what is important. And that is why it is important to kind of liaise with a good nutritionist and dietitian to kind of ensure that the diet is being followed completely and adequately.
Yeah, absolutely. So as we say in Tamil, we say unave marundu. So food is the drug. So it's very important. You could manage most of the gastrointestinal conditions with just proper diet. I have a few questions from the audience. If a child is lactose intolerant, what should the diet be?
This is again something which we do see in children and infants with Downs and in other conditions as well, obviously. And there are alternatives to milk that can be used. So that is something to kind of explore. There are alternatives such as oat milk. There are also alternatives such as soya milk. And these are things which can be explored. But also before that, the first thing is to confirm whether there is definitely a lactose intolerance, because sometimes it may be just a transient or a very short-term kind of intolerance because of certain other foods. So it is important to kind of confirm whether there is a genuine lactose intolerance, because you don't want to subject the child to some alternative diet without actually understanding whether this is the underlying problem that is causing the diarrhea or the bloating or whatever it is. So which is why I think it is important to kind of liaise with the doctor to confirm whether there is a genuine lactose intolerance. And then there are alternatives which can be used, such as I mentioned, soya milk or oat milk and others which are lactose free.
Almond milk.
Yes, of course. Yes.
Okay. The child, there's another question from a parent. The child can only eat easily digestible food. If given other foods that take time to digest, he tends to throw up or has bloating in the stomach. How can we overcome this?
Again, we do see this fairly often. First, again, it is to kind of to make absolutely sure that there is no other issue that is actually interfering with the child's metabolism or absorption. So it is useful to have this checked out, first of all, to make absolutely sure there isn't any kind of inflammation in the gut because of other reasons. So you need to kind of discuss the exact details of what is happening with that particular child with the doctor. And then that detailed assessment can be then carried out to make sure there is no other condition contributing to what is going on. And once that is done, if that is an issue with just about the actual food itself, then we need to kind of manage it by kind of looking at what foods are being able to be tolerated. So keeping a diary of the food intake is quite important, and keeping the diary for at least a few weeks, because there's no point in just keeping it for 1 week or so. It's useful to keep a food diary for maybe 2 or 3 weeks or even 4 weeks to see if you can have what particular foods which actually are being tolerated by the child, and then to kind of see how you can tailor-made the approach to actually kind of ensure that this the child gets the right kind of diet for this.
I have two questions from the audience. One says that my son is unable to eat other items like roti or dalia except rice, and he gets constipated, sometimes loose stools. And another person who says sometimes while eating rice, she gets problem. She's a 23-year-old. Only after a few minutes, she's able to eat properly. So one person is not able to eat rice at all, and the other person is not able to eat wheat at all. So these are two different issues. So is there anything that you would like to comment on this? And one other problem also, other than the gastrointestinal, I think, is the buccal musculature. I think not being able to chew also may be contributory.
Yeah,
I feel.
There are quite a few things. One is the kind of the structural issues, as you alluded to, Dr. Priya, with regard to the mouth and the kind of the chewing ability, because that can be affected with Down syndrome. Swallowing can be affected as well with Down syndrome children, as we know, because the kind of the structure of the kind of food pipe and the stomach can be sometimes slightly different from other children, and we do need to kind of take that into account as well. With regard to the wheat issue, I have already alluded to this. Could be a manifestation of celiac disease or early celiac disease. So if there is an issue with roti or any other kind of wheat products, then please think about celiac disease, think about getting tested for this, and kind of ruling that out as a possibility. Even if there is not overt celiac disease, there is a condition called gluten sensitivity, where children and babies could be just sensitive to products containing gluten, which is what is the main ingredient of wheat. So that itself, even if a blood test is negative, that could be a reason as well. So please consider that and make sure that's tested. With regard to rice, there is a difference in the different types of rice as well. As we know, there are types of white rice, there's red rice, there's brown rice, all of these different types of rice. And it may be that it's the type of rice that is actually contributing. It could be whether it's basmati or broken basmati or long grain rice. All of these different types of rice can have different effects on the gut. It may be just a simple issue like changing the type of rice to see if there is a difference with a different type of the rice formulation. It may well be that we may need to cook the rice a little bit longer to make it a bit softer for the child to be able to kind of swallow easier. So these are just some simple remedies I would suggest. If that is not solving the issue, then you might need to seek more specialist medical help as well to ensure that there is no other issue that is contributing to the condition.
Yeah, just a Hindi translation of what you have said so far.
जो अभी तक डॉक्टर ने बताया है उसी में से कुछ चीज़ें मैं आप लोगों को बताना चाहूँ कि उन्होंने एक मुख्य रूप से बता रहे हैं कि अगर लैक्टोजन इंटॉलरेंस है या कुछ इस तरह की चीज़ें हैं तो वीगन की तरफ भी जाया जा सकता है। इवन अलग अलग तरह के चावल यूज़ करने से भी बहुत सारे डिफरेंसेस आ सकते हैं। तो डाइट एक बहुत बड़ा रोल इसमें दिखाता है अपना। और इससे पहले डॉक्टर ने रिफ्लेक्सेस के बारे में बताया है और उससे कि डाउन सिंड्रोम बच्चों में मुख्य जो कारण होते हैं पेट की समस्याओं के, उसमें रिफ्लेक्सेस हैं जो खाने के बाद खाना बाहर आता है। वो छोटे बच्चों में भी हो सकता है, जो इन्फेंट है उनमें भी हो सकता है और बड़ों में भी हो सकता है। उसे हमें समय समय पर देखना होगा कि अगर बच्चे को वो प्रॉब्लम आ रही है तो टाइम से जाके डॉक्टर को दिखाना चाहिए। दूसरा, हमारे बच्चों में कब्ज़ की शिकायत रहती है तो कब्ज़ की शिकायत के लिए भी हमें ध्यान देना होगा और कब्ज़ की शिकायत में एक महत्वपूर्ण रोल थायराइड का भी हो सकता है, जिसके लिए डॉक्टर ने डॉक्टर जयश्री के लिए कहा है कि आप उनसे और ज़्यादा इस बारे में जान सकते हैं कि ये कैसे इस चीज़ को वो करता है। और वीगन के लिए और खाने में चेंजेस के लिए उन्होंने कहा है कि पेट की समस्याओं को ज़्यादातर हम उससे खाने की चीज़ों में चेंज कर सकते हैं।
Yeah, could you tell us how we manage reflux at different stages, maybe in infancy or a little older child? How do we manage? And,
thank you. This is quite a difficult entity to kind of manage sometimes, and it can be quite stressful and worrying for the parent. I completely understand. I think this again, as long as we've ruled out the mechanical causes or the kind of anatomical causes of reflux, what we then need to do is look at altering the dietary patterns. So in infancy, obviously, the child is really going to be just beyond a little bit of liquids. It may just need to be that we alter what happens after a feed. So make the child kind of be in a raised position so that the kind of the reflux does not happen as often, and hold the child for a bit longer in the raised position, maybe for even up to an hour or so that the reflux is minimized. As a child gets a little bit older, it's a little bit more difficult to do that. So it may well be that we need to kind of space out the meals a little bit more, and again, maybe alter the kind of formulation of the child of the feed as well. It may well be that you might need a little bit more of a liquid diet for a few days, to kind of ensure that this is actually kind of being retained and not brought up. As the child grows a little bit older, then there are other issues. So, whereas if they're being exposed to a lot more of fizzy drinks, for example, or caffeine, that can both contribute. So that needs to be avoided. Making the child sleep with the head end a little bit raised also does help at night. That also minimizes the reflux episodes.
So,
Doctor.
Importantly, as he said, maintain a food diary. So you know which particular food could cause the reflux. In a smaller child, keep the baby itself in a 45 degrees angle or upright for a longer time. Give thickened feeds. And avoid certain foods which could cause the reflux, and consult with your pediatrician or gastroenterologist. You may need to give some medication as well for certain period of time, and also check on the texture. I think these are the takeaways from whatever he has said. Another important problem is constipation. You would
Yes,
like to summarize the reflux? Just one second. Just a second, sorry.
Yes, of course.
रिफ्लेक्स के लिए डॉक्टर ने बताया है कि छोटे बच्चों में बिल्कुल इन्फेंट जो है उनमें इसकी समस्या अलग होती है, लेकिन उससे बड़े बच्चों में उसका कारण कुछ और हो सकता है। उसके लिए हम उन्हें एकदम लिक्विड डाइट पे ले जाकर देख सकते हैं कुछ समय के लिए, जिससे कि उन्हें आराम पड़ेगा। थोड़ा और बड़े जब बच्चे होते हैं तो कॉफ़ी, कैफीन इस तरह की चीज़ें अवॉइड करनी चाहिए, क्योंकि ये उसमें टीनेजर्स में और उससे बड़े बच्चों में मुख्य कारण हो सकता है। यस मैम।
Another major problem that most of the parents face is constipation in the child.
Yes.
So how do we address this at various stages?
Again, thank you, Dr. Priya. I think it is important to kind of recognize when exactly this is happening. In infancy, this could have different implications. As the child is a bit older, this could have different implications. In infancy, there could be a kind of a structural problem. So as soon as the baby is born, over the first few days or weeks, if there is an issue with the constipation, if the baby is not passing stool, it is very, very important to get this checked out as soon as possible, because there could be a mechanical or structural problem in the lower gut that is contributing to this, and that needs to be corrected as soon as possible. As the child grows a little bit older, there are various other factors that come into play. And a lot of it is the fact that with children with Down syndrome do have a slightly slower, what we call gut motility, which is the movement of the gut is a bit slower sometimes. And that is due to a variety of reasons. It just is kind of inherent in some Down syndrome children. And we need to recognize why exactly this is happening. Simple remedies, such as increasing the amount of fluid intake, is probably the first step. So increasing the amount of warm water, especially. Warm water is probably the best laxative known to man. So I think that is something which holds true for all of us, not just children with Down syndrome, but for all of us. Warm water is actually the best simple remedy that all of us have access to, and all of us can actually use very easily to treat this kind of very troubling condition sometimes. So that would be my first step. The second step is to try and increase the amount of fiber in the diet. So when I talk about fiber, I'm talking about things like fruit, vegetables, which in our Indian diets, we do have a lot of fiber, but it might be that we may need to look at what kind of fiber that is going in and whether there is enough of this in the diet itself. So it is important to kind of look at these. These are simple remedies that can help with improving the issues with constipation. If these do not work, then there are medications which can be used as well. But before that, it is very important to kind of liaise with the medical team and the medical professionals to ensure there is no other issue that is actually contributing to the constipation. As I alluded to, things like celiac disease, things like underactive thyroid or overactive thyroid sometimes can all contribute to kind of constipation. So it is important to kind of ensure that these issues are actually thought about, looked for, treated adequately before we then start going into detailed treatments with medication for constipation.
डॉक्टर कहते हैं
पारो
कि
एक सेकेंड, सिबलिंग में मायरा है उधर टॉडलर्स ग्रुप में। अगर मायरा के पेरेंट्स यहाँ पे, शी इज रेस्टलेस, शी वांट्स मदर, तो आप प्लीज वहां पे जाएं। थैंक यू।
Another thing about this constipation, I hope you all know what is constipation. Constipation doesn't mean that the child passes stools only once in 2 days, it's constipation. Even if the child passes every day and it is very hard stools, doesn't evacuate fully, it is still constipation. Or passes once in 2-3 days, passes like goat pellets, like small, small round balls, that's again constipation. So it is important to know that before we treat it. Yeah.
कब्ज की समस्या जो है वो डाउन सिंड्रोम बच्चों में एक मुख्य कारण रहता है, और इसके लिए ये किया जा सकता है कि सबसे पहले तो फ्लूइड डाइट लें, लिक्विड डाइट पे जाया जा सकता है, और गर्म पानी इसके लिए एक बहुत बड़ी रेमेडी है। सिर्फ डाउन सिंड्रोम ब्लेस्ड बच्चों के लिए ही नहीं, हम सब के लिए भी गर्म पानी एक बहुत अच्छी चीज़ है इसमें। और उसके बाद वो बात करें रहे हैं कि फाइबर डाइट पे जाना चाहिए। जो फाइब्रस डाइट है, फाइबर जितना ज़्यादा इंटेक होगा तो उससे उसमें फ़ायदा होगा। अगर तब भी इसमें फ़ायदा नहीं होता है तब हम मेडिकेशंस की तरफ जा सकते हैं, और मेडिकेशन स्टार्ट करने के लिए पहले बहुत सारी चीज़ें थायराइड के जैसी और भी बहुत सारी चीज़ों को देखना होगा, तभी इसमें दवाइयाँ शुरू की जा सकती हैं।
Thank you, Dr. Shankar Raman.
Priya,
I think we've had, yeah, you have one more question?
just one
You need
question I
to-
wanted to ask. We've talked about wheat, we've talked about rice, we've talked about milk. What do you feel is the role of sugar, specifically fructose, in the role of gut inflammation?
I think we've lost the link,
We've
I
lost
think.
it.
Yeah, yeah. So if we get it back, we'll
Sure.
get back to him.
Well,
Thank
our-
you.
our
I hope
diet's
that
very-
discussion in relation to gut health, that is a very important issue. We'll come back to that. Dr. Nidhi, would you like to come back on the panel? So coming back to the things, I think Dr. Sandeep wanted to leave early, so we'll just finish his question. Would you like to say something about obstructive sleep apnea? A lot of our children have problems sleeping. So some of the parents come and say they sleep upside down, they keep moving throughout the night, they keep waking up, and they, keep walking or talking. So what is your comment on obstructive sleep apnea? When do we diagnose? Do all children with Downs have to be assessed for this, and what is the treatment?
See, obstructive sleep apnea is a condition in which when the ये एक ऐसा कंडीशन है कि जब पेशेंट सो रहा हो तो रात के समय जब वो गहरी नींद में हो उस समय जितना हवा उसके लंग्स में जाना चाहिए और बाहर आना चाहिए वो नहीं होता है, जिससे उसका स्लीप आर्किटेक्चर फ्रेगमेंटेड होता है और वो अगले दिन फ्रेश फील नहीं करता है। देयर आर एपिसोड्स इसमें कि वो स्पेशली डाउन सिंड्रोम के बच्चे थोड़े इरिटेबल हों, इमोशनल आउटबर्स्ट हों। नॉर्मल लोगों में बीच बीच में नींद आ जाना, काम के बीच में नींद आ जाना, इरिटेबल रहना, और बाकी हार्ट के प्रॉब्लम्स, डायबिटीज़, ये सब कुछ कंट्रोल के बाहर चले जाना कॉमन है। नॉर्मल में डाउन अदर देन डाउन्स ओएसए का प्रिवेलेंस अराउंड 2 to 5% है, कहीं कहीं पे 10% भी बोलते हैं, बट डाउन सिंड्रोम में दिस इज एज हाई एज 40%. So the problem with OSA in Down syndrome is diagnostic overshadowing. बच्चा सुबह इरिटेबल है, ठीक से सो नहीं रहा है, तो हम लोग बहुत कॉमनली उसे डाउन्स के ऊपर ही डाल देते हैं, OSA के लिए वर्कअप नहीं करते। बहुत सिंपल टेस्ट है एक OSA के लिए, उसमें आपको पॉलीसोमनोग्राफी करनी पड़ती है। एक क्वेश्चनर है एप्लीज स्लेपीनेस स्कोर, बट वो पता नहीं कितना वैलिड होगा डाउन्स के बच्चों में, क्योंकि वो खुद को एक्सप्रेस नहीं कर पाते। तो एक पॉलीसोमनोग्राफी कराया जाए अगर आपके बच्चों में वैसा सिम्टम आ रहा है तो। उनका वजन कंट्रोल में रखा जाए। कॉमनली डाउन सिंड्रोम के बच्चे थोड़े से ओवरवेट होते हैं एज दे ग्रो अप, और अगर कुछ और सिम्टम आ रहा है तो उसको देखें, जैसे कि अगर वो इरिटेबल ज़्यादा हैं, सुबह के समय हेडेक कंप्लेन कर रहे हैं, दिन में बीच बीच में ही सो जा रहे हैं तो। और रेस्पिरेटरी हाइजीन का भी वापस से इसमें अच्छा रोल है। स्लीप हाइजीन, टाइम पे सोना है, एंड रेस्पिरेटरी एक्सरसाइजेस। तो बच्चा कोई भी फिजिकल एक्टिविटी करे, ऑटोमेटिक रेस्पिरेटरी एक्सरसाइज हो जाती है। अगर नहीं और आपके लिए संभव हो तो प्राणायाम, योगा, ये सब एक्सरसाइज कराएं, तो इससे हेल्प मिलेगा। मैडम जैसा कह रही थी कि कुछ बच्चे उल्टा सोते हैं, तो वो बॉडी का मैकेनिज्म है कि एयरवे को वो पेटेंट रखने के लिए कि ग्रेविटी का इफेक्ट को नलीफाई करें। वैसे बच्चों में आप डेफिनेटली अपने डॉक्टर से मिलें और उनको अगर लगे तो पॉलीसोमनोग्राफी करा दें।
Yeah, thank you. Dr. Shankaraman, before we, sign off with you, thank you for this very informative session. Just two last questions before you go. Do you recommend a gluten-free and a vegan diet for all children with Downs, whether they have any gastrointestinal issues or not? And what is your view on fructose in the diet?
Right. First of all, I would not recommend a gluten-free diet for all children with Downs, because this is not something which affects every child with Downs, and it's all even with the celiac disease or with gluten sensitivity, there are degrees of gluten sensitivity as well. So this is not as though it's a complete absence of gluten that needs to be happening in those with gluten sensitivity. So it is important to kind of tailor make the approach for every child. Every child with Down syndrome is unique. And I'm not talking about just being unique in the fact of having the condition, but also in Down itself. Every child is special, every child is unique. So please make sure that we approach the child in their own special way to ensure that the right diet is being followed and the right kind of approach is being followed. So I think it is important to kind of use that approach, not a completely kind of broad approach in the way the diet is followed in each for each issue. Fructose is a different kind of issue altogether. Fructose, there is some benefit with fructose. There are maybe some kind of not so good advantages with fructose as well. But I would certainly not recommend taking fructose completely out of the diet. I don't think that is something which is sensible. We again need to kind of tailor the approach appropriately to each individual child and each individual child's needs for their issues.
Thank you very much. So the message is one size does not fit all. So each child should be assessed on his or her own merits, what the child needs, and the diet should be followed. Thank you very much, Dr. Shankar, for joining us. So have a good weekend. Thank you.
Thank you.
Parent, if you are here, please be outside. Your child needs you. Jyotirma is parent. Near the sports area.
So on behalf of DSFI, we thank you for this very exhaustive session. Thank you.
Thank you very much for having
again for him.
डॉक्टर ने कहा है कि हमारे डाउन सिंड्रोम ब्लेस्ड बच्चों के लिए सभी के लिए वीगन डाइट फॉलो किया जाए, ये ज़रूरी नहीं है। हर एक बच्चा डाउन सिंड्रोम ब्लेस्ड होते हुए भी अपने आप में अलग होता है, उसका अलग तरह की रिक्वायरमेंट्स हो सकती हैं। तो हर एक बच्चे के लिए वीगन डाइट को फॉलो करना ज़रूरी नहीं है। ये हर एक बच्चे को असिस्ट करके ही पता चलेगा कि उसको ये ज़रूरत है या नहीं है। हाँ, फ्रक्टोज एक समस्या हो सकती है। फ्रक्टोज बहुत ज़्यादा कोई इतना अच्छी चीज़ नहीं है, बट वीगन डाइट हर एक डाउन सिंड्रोम ब्लेस्ड बच्चे के लिए फॉलो की जाए, ये वो सही नहीं मानते हैं। थैंक यू।
Thank you. And I would say to everyone, हम आपके साथ हैं। आप अकेले नहीं हैं।
Give a bigger round of applause for him. He is joining from a different time zone. He is not slept, and he is himself recovering from a medical condition.
Thank you very much.
Thank you. That is all nothing to do with all that you have achieved. So I'm very, very happy and very proud to be here with all of you. Thank you.
Thank you. Thank you very much. So I also will let Dr. Sandeep Jain go because he said he has some procedures. Before you go, couple of questions alone. Any specific diet that you recommend for good respiratory health for our children?
See, there is no such diet, but if the child is allergic to anything, if you see that after having peanuts or egg or brinjal, if the child is having cough or having other symptoms, it's better to avoid it. It's always recommended to have a balanced, nutritious diet with good amount of protein, whatever is recommended, and that is it. There have been few papers which talk about cow milk causing some issues. That has to be dealt with on individual basis. If your child gets symptoms with cow milk or is getting anemia and all, then you should consult your doctor.
Okay. Any question that you would like regarding pulmonology? Yeah.
It's like generally in Down syndrome children, they have the large enlarged tonsils. So it will hinder in the respiration also, like breathing process also, and they mostly have the cough also. So what should we do? It's necessary to like remove that tonsils, or we can handle it by some other things.
Madam, it's not necessary. Just an enlarged tonsil does not mean that it needs to be removed. If the patient is getting recurrent tonsillitis, then you have to think about getting it removed. But yes, the craniofacial structural changes that Down syndrome patients have, these things do cause a problem. They do cause hindrance to airflow. That is one of the reasons for them having these breathing disordered, sleep disordered breathing and all. So in such a case, individual to individual basis, you need to work up and you need to come to a diagnosis. But just because the patient has got some changes, you do not need to get it removed.
Okay. Thank you, Dr. Sandeep, for one more question. That will be the last question for him.
Hi. My daughter suffered from pneumonia just some in the month of November last year. So after just recovering itself also, she is suffering from this cough and all the stuff, and she often have this cough problem and all the stuff. So do you recommend any vaccination or anything like that?
How old is the patient?
She's 13 plus.
Okay, so the routine vaccination, I am sure, has been done.
Yeah.
Then you have to take yearly influenza vaccine and the boosters for pneumococcal whenever it's due.
Okay.
People do tend to get something called post-infection hyperreactivity of the airways. So even after resolution of pneumonia, they can get cough for a few days to few weeks. But if it extends into the months, you consult your doctor.
We consulted the doctor, and when the doctor says the lungs are clear, and so you don't have to worry. But she gets a dry cough often. Like
See, there's something called cough variant asthma needs to be worked up.
Yeah, she's on the Budacort steroids.
So the doctor has already thought about it and has given Budecort. At the age of 13, I think you should meet the doctor again. If he or she feels appropriate, they'll change it to Foracort.
Yeah, Podacort has been given now. They told like not to it's like you don't have to continue it, but continue the Budacort and the Ethylene inhaler.
Okay, that was what we used to do for asthma initially, that we give an inhaled corticosteroid and give Ethylene as and when needed. That is fine. If the symptoms are okay with that, you can continue that.
One more question, ma'am. Is it okay?
Yeah.
Good afternoon, sir. Yeah, my daughter is 31 years and I am from Bangalore. So the weather conditions there always makes her to get the cold throughout the year and stuffed nostrils. And she had a terrible viral pneumonia almost 5 years back. So during her waking hours, during the daytime, she makes a kind of snoring sound actually most of the time while she's breathing. So that's kind of irking me. So I really don't know whether it was that viral pneumonia, but that was sick for almost 5 years back.
Unlikely that it would be a consequence of pneumonia that she had. But snoring is quite common because of the changes we discussed.
Okay.
So if
But that's
she,
not during sleep time. This is during the waking hours also. She make krr kind of noise.
yeah, sometimes they do even when they are awake.
Okay.
So if there are symptoms, you look up on the internet which are suggestive of excessive daytime sleepiness.
Okay.
You can get a pulmonology consult and if required, a polysomnography done.
Pardon?
If required, a polysomnography done.
Okay.
Then there are other devices that can be used to prevent all these things. But the first question that needs to be answered is, do we need to do that?
Okay.
So for that, you need a formal consultation with the patient with a pulmonologist or a ENT specialist.
Okay, thank you.
Okay. Thank you, Dr. Sandeep. Thank you for taking your time out to join us. He has to go for some procedures.
For me?
Yeah, before he goes, please accept this token of our appreciation.
Ma'am, I have a question. Somebody.
You can ask the question.
I'm also from Bangalore. So nowadays, we got to hear from pediatrics and that saying that sleep test is mandatory for Down syndrome children at the age of 4 onwards.
Pardon, sir?
Sleep test.
Okay.
Okay. We hear from pediatricians saying that it is mandatory going forward for Down syndrome kids starting from age of 4. Okay, so is it really a mandatory thing?
Sir, I am extremely sorry. I do not know about this. Whatever little knowledge I have not come across this that every kid with Downs has to undergo a sleep test after 4 years of age. I'll look up and I'll inform them and then they'll inform you. Okay, thank you. I would like
Okay.
to thank the organizers and Haripriya ma'am for giving me this opportunity.
From ourselves. Thank you, sir.
Thank you once again for being on our panel. Please. Okay. So, Dr. Nidhi, we're going to talk on something very, very, that affects all our kids. Now, we see second row of teeth coming up nowadays. Before the primary teeth have fallen, already one more row. So, more and more teeth in the mouth. What do we do? How do we do we remove them? Do we keep them? And how do we maintain good oral hygiene? Please enlighten us.
तो आजकल पेरेंट्स का सबसे जो ज़्यादा क्वेश्चन आ रहा है वो यही आ रहा है कि मिल्क टीथ नहीं टूटे और परमानेंट टीथ इरप्ट हो गए हैं. सो ये कॉमन है, ये न्यूरोटिपिकल चिल्ड्रन में भी होता है. द ओनली डिफरेंस इज कि हमारे बच्चों में जो मिल्क टीथ है कई बार वो ओवर रिटेन्ड रह जाते हैं. वो ज़्यादा समय तक जो उनका स्टिपुलेटेड टाइम होता है एक्सफोलिएशन का, जब उनको निकलना चाहिए वो नहीं निकलते और परमानेंट टूथ आ जाता है. और ये जो स्पैन है, टाइम स्पैन, कई बार ये 6 महीने से 1 साल तक खिंच जाता है, जबकि ये नॉर्मल स्पैन 2 से 3 महीने का होना चाहिए. एक बहुत बड़ा कॉन्ट्रीब्यूटरी फैक्टर है, वो है नैरो जॉज, मेनली द अपर जॉ. क्या होता है, जब नैरो जॉ है तो उसके अंदर जो परमानेंट टूथ होता है दैट इज ऑलमोस्ट डबल द साइज ऑफ द बेबी टूथ. ठीक है, टीथ ग्रो नहीं करते. अगर लाइक आवर आईज, वो भी ग्रो नहीं करती. जो साइज है, जिस साइज के साथ बच्चा पैदा हुआ है, आईज का साइज भी वही रहता है, टीथ का भी वही साइज रहता है. तो जब जॉ छोटा है और बच्चे के मुंह में ऑलरेडी क्राउडिंग है तो परमानेंट टूथ कहाँ जाएगा? आना तो है, उसको इरप्ट तो होना है. थायराइड हार्मोन इज पुशिंग इट टू इरप्ट इन द माउथ, पर वो कहाँ होगा? वो कहीं पीछे होगा जाके. तो क्या होता है, डबल रोज हो जाती हैं, 2 रोज हो जाती हैं. और अगर थायराइड हार्मोन, एज जयश्री मैम सेड, इट इज अफेक्टिंग ईच एंड एवरी सेल ऑफ आवर बॉडी, इट्स अ मास्टर हार्मोन. अगर वो कम होता है, थायराइड हार्मोन का लेवल अगर कम होता है, तो जो डेसिडुअस टूथ है या जो बेबी टूथ है उसको एक्सफोलिएट होने का स्टिमुलस नहीं मिलता. तो वो जो टाइम स्पैन 2 से 3 महीने का था वो 6 से 1 साल तक खिंच जाता है. तो 2 कॉज हैं, एक नैरो जॉ, दूसरा थायराइड. वन इज लोकल एंड अदर सिस्टमिक, राइट. अब हमारे को इस कंडीशन में जब आप देख रहे हो कि 2 महीने से ज़्यादा खिंच गया या 3 महीने से ज़्यादा खिंच गया, तो ये राइट टाइम है डेंटिस्ट के पास जाने का. और डेंटिस्ट, they are also very aware nowadays, thanks to Rekha Ma, DSFI and many awareness programs which are happening all over India and abroad. They don't remove the tooth unless and until they do an X-ray. It's called OPG, the full mouth digital scan. कई बार क्या होता है, ओवर रिटेन्ड डेसिडुअस या बेबी टूथ होता है और हमें लगता है बच्चे का दांत दूध का है, उसको निकलवा देते हैं, शायद परमानेंट टूथ आ जाएगा, पर वो नहीं आता. कई बार डाउन सिंड्रोम के अंदर एनोडोंशिया, मिसिंग टीथ, इसका जो प्रोपोर्शन है, इसका जो इंसिडेंस है बहुत ज़्यादा है. ऐसे केसेस में हमें उस डेसिडुअस टूथ को, उस मिल्क टूथ को ही बचा के रखना है for the normal masticatory and the speech function. Is this clear? किसी को भी doubt है, then you can ask your question later on. The second part is oral hygiene. So मैं एक study compare करूँगी just to give you an idea. 100 years back or 50 years back, our children were put in the institution. They were institutionalized, जहाँ पे उनकी diet बहुत monitored की जाती थी. और अगर हम way back in 1980s
Nidhi,
की
we are
study
running
देखें,
short of time. We need to summarize quickly.
Okay, I'll do
Yeah.
it. So, उनमें incidence of caries, कीड़े लगने का incidence बहुत कम दिखाया गया है. लेकिन आजकल हम अपने बच्चों को सब जगह लेके जाते हैं, सब तरह का खाना खिलाते हैं, लेकिन उनको opportunity to clean their mouth because they have hypotonia, they can't move their muscles around, they can't spit. वो वाली अपॉर्चुनिटीज कम हो जाती हैं. तो इससे क्या होता है, जो इंसिडेंस है कीड़ा लगने का दांतों में, वो बहुत ज़्यादा बढ़ जाता है. एक और चीज़ मैं बोलूँगी इससे पहले कि प्रिया मैम विल रिमाइंड मी अगेन फॉर द टाइम कंस्ट्रेंट. जैसा कि डॉक्टर जैन ने बोला, पल्मोनोलॉजिस्ट ने बोला, और गैस्ट्रो डॉक्टर ने बोला दैट कई बार च्यूइंग का इशू होता है और स्लीप एपनिया. So nowadays, lot of studies. In fact, I'm amazed to see outside the dentist, preferably the orthodontist, pulmonologist, a respiratory surgeon, and a pediatrician. They are making teams and giving multi-prong therapy for the sleep apnea, because this upper jaw plays major role in obstruction in sleep apnea. क्योंकि नैरो जॉ होने की वजह से ये नेजल फ्लोर ये भी ऊपर उठता है, यहाँ पे स्पेस कम हो जाती है, swallowing अफेक्ट होती है, स्पीच अफेक्ट होती है. So that is one option which can be considered. It was already an option, as Rekha Ma pointed out, 40 years back also. The only thing is awareness is slowly coming. अब आ रही है, technology है, we can do that, and it is giving lot of benefits to all the children.
Thank you, Nidhi. So I'm sure we have thousands of questions, but we are running short of time. We have a 3-hour session in the afternoon between 2 to 5, where you can individually meet whoever you would like to, that particular specialist, and clear your doubts. Before you all go, just 2 seconds to 5 seconds to answer one question for each of you. Dr. Jayashree, a word on growth hormone. Is it necessary for everybody who's short?
No, children with Down syndrome tend to have a lower height, and it's not related to growth hormone deficiency. So growth hormone treatment doesn't help.
Okay, so growth hormone treatment doesn't help, not for everybody. Dr. Haripriya, what about recurrent cardiac checkups even after cardiac surgery? The hole is closed. Do they need to check again?
They need to check up again just to make sure, again, as I mentioned, the lung pressures are normal. With our increasing awareness in sleep apnea and obstructive sleep apnea, even children who have not had heart defects or have had corrected heart defects, they are found to have high lung pressures later in life because of untreated sleep apnea.
So even if you don't have structural defects, you need to periodically check up. How frequently?
Once a year, definitely.
Once a year for all our children. So Dr. Pradeep, what about the siblings? Sometimes they're worried whether they would have, if it's a normal sibling, they're worried if they would have a child with Downs.
Okay, karyotyping of the baby with Down syndrome is important. Most commonly, it is sporadic, accidental, even 95%. 5% it can be translocation. If there is a translocation type of chromosome, then we should be worried about sibling. Do the testing also, because they can be a silent carrier if the parents are. So if pure trisomy 21, 1, 2, 3, no need to worry. It is not inherited. It is not running in families. And regarding the sleep studies, there, I'll finish off quickly. There is no strong recommendation that we have to start from 4 years onwards. But invariably, these children, while they grow up, they have these pneumonia and obstructive sleep apnea issues. Once it starts, it becomes mandatory to do sleep study to look for obstructive sleep apnea. So, and I always advise a pediatrician or a genetist, somebody has to have an umbrella care, so that we will refer to the specialist. So one person should take care of all the issues. So they interrelate everything and get the opinion, rather than you get opinion differently. So
we all should
pediatrician
work
should be
as
the
a
pivotal, and then
means.
other clinicians should work
Suffer.
around them.
Yeah, Dr. Reiki, How frequently should we check for how frequent should a
So,
child
like I
be
mentioned
checked?
earlier,
Vision checkup.
definitely once before 6 months, definitely once before 2.5, and subsequently every year.
Okay, Dr. Shankar, what about checking the neck for atlantoaxial dislocation? Those who are going for competitive sports, they definitely check. Should all children be checked?
No, the thing is, if you look at children with the Down syndrome, everybody has ligamentous laxity and hypotonia, but only 1 in 5 children only get orthopedic issues. Some may have a knee problem, some may have a foot problem. So it doesn't mean that every children has to go for a neck examination. Only if they develop, suppose a child walking and running well, suddenly the walking is slowed down, or they stopped running, climbing stairs, they have a problem. Child who was very actively involved in sports, suddenly trying to withdraw from the sports, then we have to suspect neck instability. That is the only orthopedic condition. If you don't take good care of it, may end up with the weakness of both legs. Apart from that, the child is interested in competitive sports, definitely we have to do neck X-ray to make sure there is no atlantoaxial instability, especially when they are involved in gymnastics or a swimming kind of a sports.
Thank you, Dr. Rangarajan. Children vigorously sometimes flap their legs, rub genitalia, especially during adolescence, the early morning hours, or sometimes in school. It becomes very embarrassing for the parent, the teacher. How do we manage this?
Yeah, most is done behaviorally. Avoid medications for this. There are other conditions where medications may be useful, like if a kid has some obsessive behaviors or depression, where this is a manifestation of that. After proper assessment, medication might help. But otherwise, it's behavioral management. Make them understand this is not done. Give them rewards if they show good behavior. Give them some restriction from society if they start doing this. So like you can say, like if you're starting to rub your genitalia in public, you're going to sit in a corner for the next 1 hour or 15 minutes or whatever. So the child understands that he cannot do this if he wants to be in that group.
Okay, thank you. I think we've exhaustive, some of the questions. So the rest of the questions, feel free to meet up with the concerned specialist and address it later on today. So big round of applause to all our panelists.
We request the panel to please stay with us for a moment. We want to present small token of appreciation crafted by our champions to each one of you. Thank you so much. Chandni and Radhika are helping us to do that.
Dr. Jayashree Gopal. First was Dr. Nidhi Gupta, who
So Chandni and Radhika are helping us to present the specially crafted items for our panel. And we are happy to share that our champion advocates in the morning also we share, have especially created this chocolate box for all of you, Aditya and his team. So अब तालियां रुकनी नहीं चाहिए क्या बात है सब सो गए सबके हार्मोन्स लेवल डाउन हाँ yeah and these are sugar free chocolate boxes.
डॉक्टर प्रिया के लिए और डॉक्टर प्रिया के लिए इतने जबरदस्त मोटिवेशन के लिए एक बार फिर से तालियां होनी चाहिए.
As an ayat goes like, whoever saves the life of a person, it shall be as if he had saved the life of a mankind. Thank you so much, doctors, for this. Yes, can we all stand and give them applause, please? Thank you so much.
बहुत बहुत शुक्रिया आप सभी का. Ma, with your permission, we have one child who is undergoing palatal expansion. So just
निशिता राव चौधरी मदर, आप जाएंगे अपने सेल्फ एडवोकेट के पास. आई थिंक द चाइल्ड नीड्स यू. Is Manvi Mishra in the hall? Please come and connect if you are in the hall. Rashmi, is Manvi in the hall?
हम अपनी सेल्फ एडवोकेट मानवी का वेट कर रहे थे. हाँ, तो वो आ गई हैं और अब आपको उनसे हम मिलवा रहे हैं. अब एक और पैनल डिस्कशन की तरफ हम बढ़ रहे हैं.
So in this panel, we are going to have with us Dr. Sharanya Krishnan, Ms. Hema Malini Swamitri, Ms. Aisha Ahmed, Ms. Mitula, Mr. Jiten Solanki sir, Dr. Nandita Shah, Ms. Shritika, and Dr. Esther Jusa. We request our panelists to take the place, please. We request our panelists. Sir, ma'am, can we hear it for our panelists? Yes, louder. You can do better. Yeah, you have good strength to give a good round of applause. And we have our moderator, Dr. Pradeep Kumar M with us. So before giving it to him, we will request our small champion here, Manvi, to give the keynote address, please.
Good morning, everyone. I am Mami Mirza. I study in fifth class in Presidium School. I live in Indirapuram, Ghaziabad. As I am living child of my parents. As I am blessed with Down syndrome. मुझे शुरू से ही बहुत सारी थेरेपीज की जरूरत थी, रोज की एक्टिविटीज के लिए और पूरे डेवलपमेंट के लिए। इसके लिए मुझे कई तरह के थेरेपीज कराई गई, जैसे फिजियोथेरेपी, फिजियोथेरेपी और स्पीच थेरेपी। सबसे पहले फिजियोथेरेपी मेरे पीरियड कराई, जिससे मैंने गड़बड़ लेना, पलटना, उठकर बैठना, खड़े होना, चलना और दौड़ना सीखा। इसके साथ साथ मेरी फैमिली ने ऑक्यूपेशनल थेरेपी कराई, जिससे मैंने चीज़ों को पकड़ना, खाना पीना, ब्रश करना, लिखना पढ़ना सीखा। थर्ड और बहुत इम्पोर्टेंट स्पीच थेरेपी भी मुझे कराई गई, जिससे मैंने बोलना, साउंड, सेंटेंस बनाना और बोलना सीखा। मैं क्रिकेट, बैडमिंटन, फुटबॉल, बास्केटबॉल जैसे गेम्स खेलती हूँ। मैं पियानो भी बजाती हूँ। मैं ड्राइंग, डांस और योगा क्लास भी जाती हूँ। कंप्यूटर में मैं MS वर्ड, एक्सेल, पावरपॉइंट सब भी काम करती हूँ, और ये सब थेरेपी से ही पॉसिबल हो पाया है। थेरेपी से मतलब इम्प्रूव हो जाती है। हमें सही टाइम पर सही थेरेपी करना चाहिए, जिससे ज़्यादा से ज़्यादा डेवलपमेंट हो सके। थैंक्स फॉर लिसनिंग टू मी so patiently. Love you all. Thank you. Thank you all, bees, for the video. Thank you.
Thank you so much, dear. Thank you. Thanks. Thank you. Thank you. Thank you. And thank you, Manvi. So thanks a lot for this wonderful opportunity, DSFI. And we are moving on to the next session. So it's a lot of thoughts has been put in, I think. Medical issues followed by all the other issues which helps you in every day to manage children with Down syndrome, therapies and more. I have a very interesting panel here. So it's a good bunch and an interesting bunch. Comprising of a speech therapist, special educator, alternative schooling specialist, physiotherapist, financial planning expert, dietitian, dance therapist, and art therapist. So I'm sure these experts are going to throw new insights, new ideas about what and all we can try in our day-to-day management. Okay, so we'll just start with speech therapist Dr. Sharanya. Sharanya Krishnan is a consultant speech language pathologist from Chennai with over 18 years of practice. Most of you know her well. So specializing in the diagnosis and intervention of pediatric language and neurological disorders. So I'll start with her for the introductory remarks. How does the role of a speech pathologist change through the years of intervention? So what role you start with and how it goes on?
Very good morning to all of you. Thank you, Manvi, for those wonderful words. Very precious to us. Yes. So once you are associated with an invested speech therapist, I think you're stuck with them at least for 2 decades, for sure. So yes, our role begins with, early years of intervention. As I keep saying it every time, every year, year after year, the first, 5 years of your child's development becomes very crucial. It's called the critical period of language development. So we work on your child's language areas, their comprehension, expression, etc. As they grow older and they get into school, comes the time where, there comes a need where they need to be understood by others, apart from parents and caregivers. So we play a very important role in getting them to be understood by others. So we start working on their articulation, their pronunciation, and all those things. And towards early adolescence and adulthood, we also, work on their stammering. Stammering becomes, it just appears all of a sudden, and no one knows why it and where it comes from. And it is also related to a lot of hormonal changes that are happening in your child and the anxiety that comes along with that. So yes, stuttering and stammering is another area where we contribute a lot. And yes, our association goes a long way, and by close to adulthood, we become their friend, confidant, because we speak a lot to them. Day in and day out, we see them. We become very close to them, knowingly or unknowingly. This happens at some point, and by the time they are young adults, they don't shy away from discussing anything with us, be it what they like, what they don't like, their girlfriends, their crushes, what they bake, what they cook, what not. Everything is discussed with us. So we are very happy to become their friends at the end of this journey.
Thank you so much. The next specialist, Mrs. Hema Malini, special educator, masters in psychology, B.Ed and special education, working experience with children with Down syndrome for the past 13 years, worked in inclusive setups of various schools. So ma'am is a special educator, you all know, and she's been traveling with DSFI for a long time. Ma'am, so when to start special education? What is the cutoff line, or when to think of special education?
Yeah. So usually when the child is born and then we start using few therapies. Initially we start with motor. So we use the physiotherapy. But as the physiotherapy is progressing, the cognition also should progress. So if the child is expected to lift the leg, when the physiotherapist says lift your leg, that is from the cognition. It is not just the motor. So the child should also understand to do it. So it goes hand in hand. So as early as possible, the special education should start. But usually when we have to teach something called as reading or looking and responding, it happens only when the neck is stabilized. So we wait for the neck stability and then start the special education.
Okay, so we'll wait for the...
So neck stabilization again happens for each child at a different period of time. So we wait till 5 months mostly. So even before that, the neck is stable, we start.
Is that a coordinated effort of a special educator and a physiotherapist, or it is like they have to come to you only to start off the...
No, we usually work in teams. It's not like isolated. So we always check with the physiotherapist to see whether the child is able to sit or with the support the child is able to sit with the neck stability so that we can start working. Because we should not show things when the child is lying down. That's not the right position to see. So we expect the child to sit erect and look at us.
So as soon as the head control is achieved, so we work with either a physical medicine rehabilitation therapist or a physiotherapist. We focus on motor milestones early.
Yes.
Now the role of a special educator is coming in very early also.
Yes, exactly.
So,
Because when you work, just as I said, when you're working on the motor milestones, the physiotherapist tells to the child, move your hand, move your hand. That is something to do with your mind. Move your hand is not just the physical activity. The child is expected to understand the instruction and do it. So from passive to active, when they move on the therapy, it always happens with the cognition.
okay. So I have a team with where I have a special educator, I have a physiotherapist also. So
Yes.
whom should I refer for 5 months old child? First, whom should I refer to if I'm going to refer for one?
You will have to refer to both. It has to be a teamwork.
Yeah. So great. So that is a new information for even for us because we work in the hospital. We always look for older children or children who are going to school. We think of special educators.
Yeah.
But initially we always go team together with the physiotherapist and then the speech therapist. You come a little later. But from now on, we learn that your services has to be introduced very early.
Yes, yes.
So we'll move on to the next.
मैं खुद ही हिंदी में बोल लूंगी. हाँ,
Yes.
तो अभी उन्होंने पूछा कि स्पेशल एजुकेशन कब शुरू करना है. स्पेशल एजुकेशन जितना जल्दी हो सके शुरू कर सकते हैं, लेकिन हम कहेंगे कि जब कुछ दिखा के बच्चे को सिखाना पड़ेगा तो उनकी गर्दन ठीक बैठना पड़ेगा. तो उसे अगर बैठने की पोस्चर हो जानी चाहिए बच्चे के, तब स्पेशल एजुकेशन शुरू करनी चाहिए. और डॉक्टर ने पूछे कि स्पेशल एजुकेशन शुरू किए या फिजियोथेरेपी शुरू किए, कौन सा पहले शुरू किया, कौन सा रेकमेंड कर सकते हैं. तो हमने कहा दोनों बार एक बार करना है. हम जब स्पेशल एजुकेटर और फिजियोथेरेपिस्ट टीम से वर्क करते हैं, तो हम ऐसे फिजियोथेरेपी से पूछेंगे कि बच्चे अभी कैसे बैठते हैं, क्या वो सपोर्ट से हिसाब से बैठते हैं या बिना सपोर्ट के बैठते हैं, क्या गर्दन बैठ गया. तो ये सब हम पूछ के उनके साथ साथ काम करते हैं. तो दोनों की एक ही बार शुरू करनी चाहिए. I think that is the takeaway point that we have given.
Okay. So next, we'll move on to the next specialist, Ms. Aisha. She's an educator over 25 years of experience, Vice Principal, Insight Academy, Bangalore. She's in charge of more than 180 children. She's a special educator for that. She's running a separate block in the school. So it is an inclusive school as well. So she conducts workshops and awareness programs to parents, teachers, and students. Now she has come to give awareness amongst us. So the question is, what are all the concepts, options available for alternative schooling? And when should we think of alternative schooling? Who are the ideal children, or this is the time we have to move on to an alternative schooling? When should a parent think?
I'm just checking whether it's morning or afternoon. Yes, good morning, everybody. Thank you to DSFI for giving this platform so that we can reach out to more parents and children. Actually, alternative schooling is something that has actually gained a lot of momentum during the COVID times, where children could not go to school, regular school. I would say that initially we should definitely get our children into a regular school, get them that social skills, those things that they learn to live together as a community, that will come only when they are mingling with the others. So that is definitely said thing. When the pressure of academics goes high, okay, because in schools we have a regular set of subjects that they have to do. Mathematics may not be everybody's cup of tea. And in schools, we have some limitation, as in, I cannot admit a child who is 9-year-old into UKG. Right? There is a mental age and there is a biological age also. So I have to look at both things when we are giving admission to a child in school. So it is not, when we are trying to do that balance, somewhere we have to compromise. Either I'll have to look at the mental age, or I'll have to look at, the biological age and then give the admission, right? So they may not be able to do all the things that are required at that particular grade level, right? So in such cases, when it becomes too much of a strain especially, the best thing to do would be to go for alternative methods that are there, right? So like NIOS is one of the options, which is really very good and very beneficial for our children.
Okay. So is it easily available everywhere? So there are specific cities where only the alternative schooling is available, because we have only two options, either normal school or some specials. So there are pros and cons in each concept for our children. So is it easily available? The NOS schools are easily available. If not, what will be the better option? If that is not available, what will be the next best option for children?
Right. In many schools now, especially in Bangalore, we have schools that have NIOS also as a curriculum. So our school is ICSE school, but we do have NIOS because we felt that ICSE is a little difficult for our children. So we have this option, and there are many schools that have that option. Not only in Bangalore, everywhere we have schools with NIOS. If they are not able to find a school that has NIOS, they can also do homeschooling. NIOS is a open schooling. It's a National Institute of Open School. So what happens is all the curriculum, everything is online itself. You have, access to videos. You have access to all the study material. So even in remote villages, it is possible for us to, reach out to children.
Okay. Getting interesting. I'll come back to you in the next round.
Definitely.
So next we'll move on to Dr. Mithula. Mithula is a physiotherapist.
डॉक्टर मैं थोड़ा सा अगर हिंदी में बता दूं तो आयशा जी कह रही हैं कि हमारे बच्चों के लिए सबसे अच्छा तो यही होता है कि नॉर्मल स्कूल में उन्हें भेजा जाए, और अगर वो नॉर्मल स्कूल में नहीं जा रहे हैं तो NIS फॉलो किया जा सकता है, जो कि एक ओपन स्कूल है जिसका करिकुलम ऑनलाइन आपको मिल जाता है, और वहाँ से आप जाके बच्चा अपने ग्रेड्स को एक के बाद एक अचीव कर सकता है। सेकेंड, थर्ड, फोर्थ, फिफ्थ क्लास आप सभी में जा सकता है। अच्छा तो ये है कि कोई स्कूल हो आसपास जिसमें वो जा रहा हो और साथ में NIS भी फॉलो कर रहा हो, तो वहाँ से उसको वो एक तरीके से डिग्री कह लें आप या फिर सर्टिफिकेट कह लें, वो आपको मिलता चला जाता है। तो NIS आज के टाइम में एक बेटर ऑप्शन है हमारे बच्चों के लिए जब वो एक टिपिकल नॉर्मल स्कूल में नहीं जा पाते हैं। थैंक यू।
Thank you. So Mithula is a physiotherapist associated with DSFI for past 7 years, has done DPT in SRMC, for sports and neuro rehabilitation in parents, right? Okay. So she's a well-known physiotherapist, she's been traveling with us. You all know her very well. So the question here is, what is your role? So generally introductory remarks and where your role starts and where it ends. Does it really end?
Hi, good morning all. This is Mithula here. The role of role of physiotherapy plays a major role in early intervention, that is 0 to 5 years. But the physiotherapy part continues even after 5 years. So the main role of a physiotherapist is to work on the gross motor skills, that is the developmental milestones. So the first thing which starts with strengthening the core. Core is very important for our kids with trisomy 21 because of their hypertonia. So we mainly focus on their developing milestones and progress through their posture as well as balance as well as the gait pattern. And we focus, I specialize in aquatic therapy also. So we do aquatic therapies for toddlers with trisomy 21 to develop their milestones, even progress more faster. And we work with the speech therapist as well as the special educator once the sitting balance of the child improves.
Oh, thank you so much. So we'll come back to you in the next round again. So next we'll move on to Mr. Jitendra. Again, an interesting panelist here. He's a financial and estate planner. He's working exclusively for families with children with special needs. So he runs a private limited, the company, Special Need Estate Planning Company. And he's written a book, Financial Planning for Families Having Children with Special Needs. So it's a new field, sir. Of course, we are all ignorant about it. Financial, nobody knows, most of us don't know. So when should they plan, particularly families with children with special needs, with Down syndrome? When should they start planning financially? What are all the aspects of financial planning?
See, it's a very important question because our life or our child life, after us will revolve around the money, right? When we are earning, it's easy for us, for that we are arranging for the child, we are spending money for his expenses or her expenses. But after a lifetime, what we leave behind is the money available to anybody who will take care of the child. Okay. So financial planning in that sense becomes very, very important because uh, I mean, most of us won't have any legacy coming in from, anywhere. And suddenly the money would be available tomorrow. Whatever we have, we will have to accumulate money. And when you have to accumulate money, then it takes a lot of time, right? When you are saving your money, your investments, you need time to grow your investment, right? You need 10, 15 years when you will save money on a periodic basis, and then you will reach, to accumulate money. Then there are issues that what happens to me, then where would the money come from? So all of these are very important question. And because it's going to take time to accumulate money, the financial planning should start as early as in your life. I always say that find the moment you come to know about your child diagnosis, the financial planning should start, because now you're going to plan for two generations. One is you yourself, and the second is for the child. So there are two generations involved. And in a traditional planning, we know that when we are planning for ourselves, for our own retirement, what amount of money we cater to. Okay. So when you are planning for two generations, the requirements are much higher, and you need time. You need time to save your money and accumulate money. So for me, the financial planning should start the moment you come to know. Yes, there are stages where probably you are going through that, acceptance of child disability, coming out from it, and then you start planning. But I have seen parents who are coming to planning, when they are in the verge of retirement, and suddenly they are finding out that they don't have enough money. They don't have enough money to leave behind for their child because they have their own retirement years. And today, with longevity happening, your own retirement will extend to 30 years of lifetime. So you spend 30, 40 years accumulating money, and now with the corpus, you want to, live for next 30, 40 years. Add to it the child expenses also, you need a corpus. And to accumulate that corpus, you need time. To me, at least 15, 20 years you need to save your money and to accumulate money. So the financial planning should start as early as possible.
Okay, great. So we'll
शुक्रिया
move.
जितेंद्र जी.
Hindi, is it? Can you talk in
हाँ, मैं हिंदी में बोल सकता हूँ, कोई प्रॉब्लम नहीं
Go
है.
ahead.
सो बेसिकली हमारी लाइफ पैसों पे के इर्द गिर्द घूमती है. जब हम कॉर्पोरेट में एंटर करते हैं तो हम मनी स्पेंड करना स्टार्ट करते हैं. देन फाइनेंशियल गोल सेट होते हैं, कार खरीदना है, घर खरीदना है, और अपना फिर रिटायरमेंट होगा. हम सेविंग स्टार्ट करते हैं क्योंकि पता है कि सडनली मेरे पास कहीं से पैसा नहीं आएगा, मुझे ही सेव करना है. तो सेविंग स्टार्ट होती है. अब जब एक स्पेशल नीड चाइल्ड आपकी लाइफ में आता है तो आपकी रिक्वायरमेंट सडनली डबल हो जाती है. अगर आपको अपने रिटायरमेंट के लिए 2 करोड़ चाहिए जब आप रिटायर होंगे, तो स्पेशल चाइल्ड के साथ और एडिशनल 2 करोड़ चाहिए, क्योंकि उसकी भी लाइफ स्टेज अब इन्वॉल्व है. तो यानी कि मुझे 4 करोड़ का कॉर्पस एक्यूमुलेट करना है. अब कहीं से कोई लेगेसी तो नहीं आने वाली सडनली, तो मुझे ही एक्यूमुलेट करना पड़ेगा. और कहते हैं कि शायद फर्स्ट 1 करोड़ एक्यूमुलेट करने के लिए आपको 15-20 साल का टाइम चाहिए, लेकिन एक बार वो एक्यूमुलेट हो गया, देन मनी वर्क्स फॉर यू, फिर पैसा आपके लिए काम करता है. तो इसलिए बहुत जरूरी है कि फाइनेंशियल प्लानिंग, और फाइनेंशियल प्लानिंग में और बहुत सारे एस्पेक्ट इन्वॉल्व होंगे. जितनी जल्दी लाइफ में स्टार्ट हो उतना अच्छा है. मेरी राय में द मोमेंट आपको पता लगे कि यू हैव अ डाउन सिंड्रोम चाइल्ड, और उसके लिए भी आपको अलग से पैसा जोड़ के रखना होगा, फाइनेंशियल प्लानिंग स्टार्ट हो जानी चाहिए.
Thank you. So, another interesting topic is diet. So diet, nutrition, the concepts are changing. So when we started our practice, we were thinking more in favor of fat-free, cholesterol-free diet. Now we are moving on to carb-free and a more protein diet. So this is regarding us. And then regarding children with Down syndrome, we have so many queries regarding that. And I invite our another expert dietitian, Dr. Nandita Shah, to introduce herself and give her introductory remarks.
Hello, everyone, and thank you for the introduction. And I'm actually grateful to be here. This is my first time speaking to a Down syndrome audience. I have spoken a couple of times to other neurodiverse audiences, I mean, parents of neurodiverse audience. And this is not my specialty. So I'm a doctor. And over a period of time, I realized that in general, medicines never cure. I mean, medicines may remove symptoms temporarily, but they don't cure. And so I was treating people with lifestyle diseases like diabetes and hypertension and all these things, also hypothyroidism and many of the problems that even Down syndrome children suffer from. And I found that if we think about what is the cause of the disease and remove it, we are getting very good results. And it's not only me, there are a lot of people around the world who are doing this now. And we are getting fabulous results. So I started an organization called Sharan. Sharan stands for Sanctuary for Health and Reconnection to Animals and Nature. Why reconnection to animals and nature? Because I found that animals and nature know how to be well, and we don't. We are having so much sickness amongst us. I'm not talking about just Down syndrome, but in general, amongst our human population, we have so much sickness. So what are we doing wrong? Because animals in nature know how to heal themselves, but we don't. So making that connection, how can we help every single person get well? And I was invited here by Deepa Shivaji and one of your team members. And the reason she invited me was because we have a 21-day health retreat, and her husband, who had heart disease, had come for that retreat. And she came along with her daughter for the same retreat. So I told her during the retreat that, you know, this is good for your daughter as well. And she was hesitant. And hesitant because change is difficult. I can imagine that change is difficult for any of you because already there's so much, you know, that you have that you're doing on top of what, you know, a general normal person would do. But the results are so transformational that it's worth it. So Deepa came with her daughter and her husband, and of course her husband got the results. But over a period of time, she saw that her daughter got the results, which is how I ended up here. Now, while I'm here, I also want to point out to Parini here. Parini is right in front in the pink dress. Parini, you can put your hand up. And Parini didn't come to us, but she actually got to know about lifestyle changes through a neurodiverse group that she was with. And she started those changes, and her son saw so much benefit. As her son got benefited, her family got benefited, she joined our team and she's helped so many. So all I want to say is that this will not just improve your children's health, it will improve your family's health. And so it makes a transformational difference. And the change, to make the change, you know, the reason we have a 21-day retreat is because it takes 21 days to change a habit. Imagine if you were to try it just for 30 days at home, understand it and try it and do it. You can see the changes and then decide whether you want to do it lifelong or not. That's my thought. And so I know that in the afternoon we have individual sessions, but I thought that for what I'm doing, individual sessions are not required because honestly, my individual sessions with patients is no less than 1 hour. It actually takes more than 1 hour. So I thought that let me do a session for everybody together because it's not very different what the diet that is recommended, but it's very different from what you may be thinking about right now. You may have heard about lactose-free or gluten-free diets. And should I stop now or should I just finish the...
Maybe you can finish off maybe in 1 minute time.
Yeah, 1 minute. You know, you may have heard of lactose-free and gluten-free diets. Now, why lactose-free? If you think about it logically,
Every mammal produces milk only for their young. And in nature, no animal drinks another animal's milk. That means pigs don't drink goat's milk or monkeys don't drink elephant's milk. We are the only species that drinks another animal's milk, and that too after infancy. Now, if you understand it properly, then consuming another animal's milk is a little bit like putting diesel in a car that runs on petrol. On the long term, it doesn't work. On the short term, though, what it does is milk is mucus forming. And if we stop consuming dairy products, colds, coughs, respiratory problems become much less. And that's what, you could ask Parini, that's what she saw very quickly in her child. So maybe later Parini can say something. So that's basically the introduction. Even gluten, like, we think that we're omnivores.
Nanita ma'am, just 1 second. We have an important announcement.
Yes.
Namita Maji ma'am and Falguni Acharji ma'am, if you can be with your child, they need you. Thank you. Quickly.
Yes. Yes. We think that gluten, everyone eats wheat, right? Wheat and rice are our standard foods. But, we've been told that we're omnivores, but think about it. There are animals that are herbivores, omnivores, and carnivores. And they each know what to eat instinctively. Instinctively, so do we. Like if we have a cow, we will give it grass only because the cow knows it needs to eat grass instinctively. Or a lion knows that it needs to eat meat. If we are in nature, if we are on a farm and you see fruits and vegetables, instinctively you will pick them. But if you see a chicken walk by or a goat or a cow, our mouth doesn't water, even though we may be used to eating meat. And also, if you see green fields of wheat and rice, we don't salivate just because we can't pick it and eat it right away. Like every animal can eat their food whole and raw. Now, this seems like a really big challenge because how can we change everything? And I just want to assure you that it's so much easier than you can even imagine, and the results are so transformational. So I'll end there and we'll talk a lot more in the session. And I invite everyone to come for the session. In fact, I was just thinking that if we have 3 hours for the sessions in the afternoon, then I could do one whole presentation for 1.5 hours and another whole same presentation again, the other 1.5 hours, so that different people could come, or I could do one presentation and then Q&A, so that, actually you can actually try it once you leave here and see whether it's worth it for you or not.
Okay, ma'am. Yeah.
मैम कह रहे हैं कि दवाइयाँ हमें सही नहीं करती हैं, वो सिर्फ हमारे सिम्टम्स को कुछ समय के लिए दबा देती हैं। बीमारी का कारण पकड़कर उसका निवारण करना, ये हम अपनी संस्था शरण में करते हैं। और ये आप सोचने की बात है कि जानवर बीमार क्यों नहीं पड़ते हैं। हम इस पर ध्यान दें तो हम इस बात को समझ जाएंगे कि उनकी और हमारी लाइफस्टाइल या दिनचर्या में क्या अंतर होता है। आप ही की दोस्त दीपा अपने पति की हृदय बीमारी के लिए मेरे पास आई थी और मैंने उन्हें बताया कि उनकी बेटी के लिए भी ये खाना काम करेगा, और उसने किया। परिणी को भी इसका पता चला और उसने भी ये लाइफस्टाइल अपनाया, ये दिनचर्या अपनाई, और उन परिवर्तनों से उसके परिवार को फायदा हुआ, तो उसने दूसरे लोगों को भी इससे जोड़ा है। किसी भी आदत को बनने में 22 दिन लगते हैं, इसलिए हम इसके लिए 22 दिन का समय लेते हैं। आप 30 दिन के लिए इसे अपने घर में रहते हुए ही इस्तेमाल करके देख सकते हैं। ये बिल्कुल ऐसा ही है जैसे लैक्टोज फ्री डाइट के लिए हम अपने बच्चों को बोलते हैं, लेकिन आप ये देखिए कि जो जानवर दूध पैदा करते हैं, हर एक जानवर अपने बच्चे के लिए दूध पैदा करता है। एक सिर्फ इंसान है जो दूसरे जानवर का जो है प्रोड्यूस वो दूध करता है, तो उसे हम पीते हैं। ये ऐसा ही है जैसे डीजल की गाड़ी में पेट्रोल को डाल देना। बहुत सारी समस्याएं हैं कोल्ड एंड कफ आदि की जो इससे दूर होती हैं, और बाकी और
Okay, thank you. So we'll move on to the next specialist, dance therapist, Mrs. Ritika. So you please introduce yourself and give your introductory remarks.
Thank you. Thank you. It's an honor and privilege to be here. I'm Shritika, been associated with dance for the last 40 years, been associated in inclusive spaces like this for the last 40 years by Dr. Ambika Kameshwar, and Rekha Aunty and Bubbly are all 40 years of association. I've done my PhD from IIT Madras in organizational behavior. And I'm here to talk about dance, but I'm not going to sit and talk about dance, surely, and I'm not going to allow you to sit and listen about dance as well. So if I can request each one of you to leave your bags down and stand up, including the panelists, if you don't mind, and our lovely translator, and Samiksha, who's helped us warm up with clapping. So we're going to use a little bit of that. Just a few minutes to let you get warmed up, and then I don't have to speak and tell you what the benefits are.
Please switch up the
मैम
camera.
कह रही हैं कि डांस के बारे में बात
Yes,
करते हुए वो
good.
बैठकर बात नहीं कर सकती हैं, तो वो चाहती हैं कि कुछ एक्टिविटीज आपके साथ हों, तो ये एक वार्म अप की तरह होगा हमारे। आइए मैम को ज्वाइन करिए।
Okay, so thank you very much. Just a little bit, see what it does to us, right? The endorphins, the dopamines all get released and the cortisols come down. So one of those changes happen with just movement and music. And you don't need stage, you don't need costumes, you don't need orchestra or anything big. You can include this in your everyday ritual, right? If you want to get your children ready to do something, can you play the first music, sir? If you want them to get ready or do something a little faster instead of walking slowly, you can just inject music in the air in your home and they'll start. So you can sit and clap now. 2, 3, 4. They can tie, you can teach them to tie shoelace, you can ask them to brush their teeth fast, you can ask them to bathe fast, wipe, whatever you want them to put medicine in their mouth. You can do this with music and movement. It just lightens up the air, right? It develops. Thank you, sir. It kind of develops a sense of motor control, coordination, a whole brain development. What we did with the right hand and the left leg just gets the whole brain development going as well. So I just wanted to tell you, it's very simple, and it's not only for the children, it's for the parents most importantly. If you're stressed, when you're cooking, you can just put some music and make sure you follow the rhythm. So it's not something that you go to when you're not well or you need therapy because you need to be treated. No, it's something that keeps you healthy, right? It's something that just lightens up the spirit in you. So I just wanted to give that introduction to dance therapy, and I'm very happy to take questions.
Thank you. Thanks a lot. It was a wonderful demonstration. So demonstration of just an ice-breaking moment every day. You take up that ice-breaking moment and you're on your toes. The energy level will be very, very high. It's a family therapy. It's not only a dance therapy for children with Down syndrome. It's a family therapy. We all enjoyed as such now. Thank you so much, ma'am. So we'll move on to the next expert, Dr. Esther Zouza. PhD in Arts and Special Education. She's researched on visual art in young adults with Down syndrome. She's the only researcher in that topic. She's the founder, director of Arts of the Earth, Arts Education Consult. She runs an art education consultancy. So I request you to give your introductory remarks. And what is the concept of the art therapy.
Thank you so much, and thanks for being here. And the simple concept is that I'm an outsider here, but because of the art, I become an insider. And that is the power that it gives. As parents, we're all outsiders. We do not know Down syndrome until it happens. But your child opens up a world to you. And what I have discovered through the art, I've been able to move into many different worlds. I've been able to see what matters to your children. But also I've been able to see the role parents play, not to ignore your child, because not being able to speak doesn't mean having nothing to say. In fact, I work with typical developing children, and I see having a lot to say, or being able to speak doesn't mean you got anything to say. And I always say, if you got nothing nice to say, don't say it. But what I found with Down syndrome, that when I did my PhD, and it was 6 months of intensive video. So you will see, I observe parents and I work. And then I look in every gesture they make. I see every choice. And I start with independence. If you do not know how to clean your materials, don't make art. It starts from very young, playful engagement with your children, you know, dance, taking 2 rocks and a leaf and making a face on paper, working with shadow play, which is amazing. There's so much to offer. The only thing I can say so far, I'm still a learner. I learned so much from being here, and I thank Rekha so much for being here and continue that field of learning. And I can only tell you, your child has so much to offer in terms of parenting, but also in fighting artificial intelligence, because there is no chat GPT or anything that can beat your child in thinking. That's all I can say, and that's why I love my work.
Thank you, thank you. So the next round, we'll finish off. This one will be like a rapid fire. So can, yes.
आज सर मैम कहती हैं कि मैं यहाँ एक बाहरी व्यक्ति के तौर पर आई हूँ, लेकिन आर्ट ने मुझे अंदरूनी बना दिया है। यही हाल डाउन सिंड्रोम के साथ है। जब तक ये आपके किसी नज़दीकी को नहीं होता है, तब तक आप इसे नहीं समझते हैं। मैं हमेशा कहती हूँ कि यदि आपके पास कुछ अच्छा बोलने को नहीं है, तो चुप रहिए। मैंने पीएचडी किया है और मैं बहुत सारी चीज़ों को तब समझ पाई हूँ और इन चीज़ों को डिकोड करती हूँ इस तरह से कि आर्ट किस तरीके से वो भी एक कहने का ही तरीका है और लोगों से जुड़ने का एक तरीका है, और इसमें आजकल की एआई और चैट जीपीटी और इन सब चीज़ों के लिए मैं अलग ही देख सकती हूँ, बाद में बात।
Thank you. So we have time, so no need for rapid fire session. Can we elaborate again? So Saranya, the question is, what is your, take on speech therapy? What is our ultimate aim to get vocabulary or to make it clear? Because sooner or later they are going to gain that language power. But the issue is it is not clear. They'll have this slurred speech. Stammering, stuttering, you are going to manage. That is all pathological. But what is universal is that the slurred speech or the speech which everybody doesn't understand. Okay, what is your aim, ultimate aim in achieving the speech level?
My ultimate aim is to get them to develop holistic communication skills. It's not about speech. It's not about speaking verbally, using words to speak. Okay, you can use your eyes to speak. You can use your, art form to speak. See, the thing here is, yes, all children, any person with Down syndrome has the ability to speak. They are beautiful imitators. They can imitate us beautifully. So if they can imitate your facial expressions, they can as well do it with, words. But we need to understand that, putting that pressure on them and not giving them the time to come out with the acquired vocabulary and language there lies the biggest problem. So if there is an Unnati speaking on stage in front of an audience of 500 odd people, it is because she has been given the time to bloom for the acquired vocabulary, receptive vocabulary to come out. And that is something that we have to address. And as parents and caregivers and healthcare providers, I think we have to give them that time and not rush ourselves, pressurize ourselves, stress ourselves, and in turn pass it on to the kids. So let's wait to see the magic to unfold. And being in a hurry is not going to help at all. I think Rekha Aunty will vouch for this for sure. She's waited for many years for Babri to actually speak, and I've heard it from her many times.
डाउन सिंड्रोम से प्रभावित बच्चे उतना ही बोल सकते हैं जितना कि कोई और बोल सकता है। बस बात ये है कि आपको उन्हें समय देना पड़ेगा फ्लोरिश होने के लिए। और मैम ने बोला है कि आपको अपने आप को भी एक तरह के दबाव से अपना पीछा करने जैसे काम से बचना होगा। आपको समय देना होगा अपने आप को भी और बच्चे को भी, वो भी उतना ही बोल सकते हैं। कल आप लोगों ने देखा कि उन्नति यहाँ पर जिस तरीके से बोल रही थी इतने सारे लोगों के सामने, तो दूसरे बच्चे भी ऐसे बोल सकते हैं। बस बात ये है कि उन्हें उस भाषा ज्ञान की, शब्द ज्ञान की समझ के लिए समय देना होगा।
Great. So Hema, so question is special education. Is it one single concept across all ages? So you will be handling infants, toddlers, school-going children, adolescent and adults.
Yeah.
Each one of them will need different types of special education. So in one word or one sentence, for an infant, what will be our target? For a toddler or school-going child, what will be our target to achieve? Now, what will be our focus at least? This is what I'm going to focus on this age.
I got your point. I have to be very crisp.
Thank you.
That's what I got the point.
Yeah,
Okay.
yeah.
So I will be very crisp. As special educator, we are not academicians. We are not going to teach A, B, C, D. We want to look at holistic development. My answer is complete. Holistic development throughout the ages. Whether it is an infant, toddler, or adolescent, or an adult, it has to be holistic development. As a special educator, I will not say, I will teach the child how to write ABC. I will not say, I will teach the child how to read and write. This is not special education. A special education is to see holistic development. Done?
Can you be still more precise? Yes.
Oh, thank you. So more time for me. So now I will say, when we say special education, I will have to see whether the child is able to understand. That's of course a part of speech therapy, where they call it as receptive language. Yes, as a special educator, I have to improve the child, that part of it. When we say the child has to say it out, that is expressive language, which the speech therapist will do, but I have to stimulate my child. When I say the child has to play a game along with other children as a special educator, I have to train the child to do something which is a part of physiotherapy. So now we all have to work in team. Now I have an additional team member, that is Mr. Solanki. I need him very badly. Now I understood how good he is. So I needed to team up with him also to see that my parents will have enough money to spend on all these things. Now I have arts therapist. From the beginning itself, we give finger painting. We don't start with a pencil. So right from very small age, the child should be able to touch any paint or even a turmeric powder at home. Haldi bhi ho sakti hai, ya paint bhi ho sakti hai. The child is supposed to touch and do the dots or painting. This is a part of the art therapy, no doubt, but I need the tactile. So we use that also. So now she is also my team. So I'm adding up everyone, but we as a special educator work throughout everything so that the child will get through everything. Of course, the diet is next to me. That's a part of the mother. We'll give it to the mother. Okay. There's a home program we give it. So we have to be in conjunction with everyone. At the same time, say that stimulate the child so that the child will be a part of every other field. It cannot be just the academics.
Great, great. Thank you.
Sir, I just have one point to make over here. With respect to these therapies, it cannot be a generalized program at all. It is tailor-made to suit every child, the child's likes, dislikes, abilities, whatever the child can do. And we have to focus on the child's limitations, and it you know, a general rule or a thumb rule doesn't work most of the time. So we do discuss amongst ourselves, you know, and there is a lot of overlap. We need to make that point very clear that there is a lot of overlap in the things that we do.
Great. So we need a team, wonderful team who evaluates holistically, and the achievements are not like universal. This is the achievement it is aiming at. It depends on the child, depends on what their capabilities are, and they grow as an individual over a period of time. That is what I understood from all of. Is it right?
Yes.
Yeah, great.
It
Thank
is
you.
very, very individualistic. हम बोल सकते हैं खुद ही बोलो ना खुद ही बोलो ठीक सो स्पेशल एजुकेशन क्या होती है इसका वही सवाल था और हर एज में क्या क्या सिखाते हैं सवाल तो वही था लेकिन हर एज में जो भी सिखाते हैं होलिस्टिक डेवलपमेंट माने पूरे बच्चे का पूरा परिवर्तन होनी चाहिए ऐसे कि नहीं एकेडमिक्स से सिखाते हैं स्पेशल एजुकेशन में सिर्फ अक्षर सिखाते हैं लिखना सिखाते हैं पढ़ना सिखाते हैं ऐसी बात कुछ भी नहीं होती है पढ़ना लिखना होती है वो भी क्या होती है हैंड की मूवमेंट के लिए होती है और दिमाग की कम्युनिकेशन के लिए भी होती है जब पढ़ सकते हैं तो जब लिख सकते हैं तो कम्युनिकेशन ज़्यादा बढ़ जाता है लेकिन बाकी सब भी होनी चाहिए इसलिए कहते हैं होलिस्टिक डेवलपमेंट के हिसाब से हम चालू करते हैं और हर एज में यही होते हैं अगर एडोलेसेंस का भी वही हमारे पास आ गया तो स्पेशल एजुकेशन क्या होती है हम कहेंगे एकेडमिक्स भी कर लो लेकिन एकेडमिक्स किस लिए करना है कम्युनिकेशन इफेक्टिव करने के लिए करना है और क्या सीखना है पैसे का हिसाब भी सीखना है तो हर एक एज में अलग अलग सी चीज होती है और हम सब मिल के सिखा सकते हैं सब एक जगह से माने आर्ट्स भी होती है उसमें स्पीच थेरेपी होती है फिजियोथेरेपी होती है और लिखना पढ़ना भी होती है सो ऑल टुगेदर इज कॉल्ड एज स्पेशल एजुकेशन
Thank you. So Aisha, yeah. So question is about India is diverse. Okay, so say India as a country is diverse. Even in one particular state, we don't have uniform educational setup. And the availability, again, that is the question, is there all the time. I asked you previously also. So amongst all these, all the schooling types, methods, models, we have an option of an alternative schooling, and there are options like daily boarding, weekly boarding, or daily regular schooling coming back to home, which would be preferable for a child with Down syndrome. And again, the NOU's examinations, what we write from home also, is it valid? The certificates offered or valid like any other certificate?
Thank you for that question. Every child is unique, every child is different. So what suits one child may not suit the other. Having said that, I always believe that family is a place from where we can draw a lot of strength. The kind of connection that you make with your family members, that adds up to your own personality as well as, you know, the strength, the confidence that we have. So I wouldn't say that a child, any child for that matter, should be put in boarding. I would say a family is very important. Schooling is required, but there should be a lot of parenting, siblings, you know, the rivalry also included. All that should be there. That's part of growing up. Otherwise, there's kind of a disconnect. You know, you don't feel you're connected to your family. That's what I believe, especially when they are very young. So again, it depends. So if I'm not getting all the facilities at one place, I'm staying in a rural place, I cannot afford to shift my entire family maybe to city, then maybe I can think of some options. Again, I have to weigh the plus and minus and then make a decision. So that's one thing. And regarding the NIOS, the certificates, and it is valid throughout the world because it's not by any small organization. It is from the Ministry of HRD, Government of India. That is what it was. It was started by them in 1983. And it is well recognized. There is an equivalence certificate given by the Government of India regarding this. And actually speaking, anybody, suppose the child has done NIOS in grade 12 with the proper subjects that are required, they can even write the NEET exams, CET exams, so that itself says that it's equivalent to any other certification.
Thank you.
आयशा मैम कहती हैं कि खाली एजुकेशन ही आवश्यक नहीं है, परिवार और सिबलिंग और उन सब का साथ भी बच्चे के पूरे विकास के लिए आवश्यक है। और जहाँ तक NIOS के सर्टिफिकेट्स का सवाल है, वो सिर्फ इंडिया में ही नहीं, ऑल ओवर द वर्ल्ड वैलिड हैं, यानी कि वो हर जगह चलेंगे उसी तरीके से जैसे दूसरे संस्थानों से दिए हुए सर्टिफिकेट या डिग्रियां चलती हैं, क्योंकि ये भारत सरकार की मिनिस्ट्री ऑफ HR से प्रस्तुत किए गए हैं और उन्होंने इसकी संस्तुति की है। तो ये बिल्कुल एक NIOS के सर्टिफिकेट बिल्कुल वैसे ही हैं जैसे किसी आम स्कूल या गवर्नमेंट स्कूल से हम पढ़ते हैं।
Thank you. So, Mritula, so when will the role of a physiotherapist end? Is there an end? Let's say the child has started walking, balance is okay. So can we stop physiotherapy? Same time. We also work as adults. We work. We have these traumas, injuries related to work also. Work, sitting, balance, all these. Do they need to continue some sort of physiotherapy, even though they started walking, and though their balance is good? Considering their hypotonia, considering the balance, do we need to continue some sort of exercises at least for every day for a child who's ambulant and very well?
Definitely, we should continue with the small exercises. Like as Dr. Shankar mentioned, our kids, due to the low muscle tone, they'll have a ligament laxity and they are prone to osteoarthritis and other conditions. So definitely physiotherapy plays a major role in strengthening their exercises so that we can prevent those musculoskeletal issues happening and all. And the physiotherapy part doesn't stop with walking alone. So we have to progress. We have to ask the parents, like, what is the lag in the child? So when they say that the parent, when they say that my child has not come into jumping stage or running stage, so the physiotherapist has to progress the exercises according to the protocol. And one more thing I want to add is like even adolescents with the trisomy 21, they have to continue with their mobility exercises every day so that they can prevent like, aches and pains and all that. And I would like to say a word like I do get calls from parents and their physios doing the exercises for our children with trisomy 21. And most of the videos I see, it's like, the physiotherapists push the kids for other milestone. The particular milestone is not, if the sitting of the baby has not been achieved or that walking pattern is not achieved, the physiotherapist will push that child or the baby, like giving them passive exercises. And the timing also, like what happened is like the timing of the therapy, because due to low muscle tone, there'll be some muscle weakness actually. So there's a particular counts they have to follow, the therapist. But some therapists are giving the exercises for half an hour or 1 hour. So that pattern of timing also will not suit for kids.
Okay.
Yeah.
So on the other hand, I got the information, but the specific question is, they are all walking now, and it is an ongoing process. They have hypotonia. We expect some sort of arthritis. We expect some spinal issues, scoliosis developing over a period of time because of the hypotonia, maybe weak muscles.
Yeah.
So to tone their muscles, do they need to follow regular physiotherapy every day? It's like stretching exercises or some yoga exercises.
Yoga,
we
core
do know.
strengthening
So is there some
exercises.
recommendation which they have to follow every day to prevent that? This is like early intervention, anticipatory guidance. We don't want them to have musculoskeletal issues later. To tone their muscles, even though they are walking now, can we have some long term? Should they have long-term physiotherapy every day for 1 hour? They have to do like
half an hour every day is
there some recommendations or recommended exercises like can you
recommended
suggest?
exercises, like they can go for some core stability exercises, some knee strengthening, and some spine mobility exercises to prevent musculoskeletal issues and all that. So
Over a period of time.
over a period of time.
डाउन सिंड्रोम से ब्लेस्ड बच्चों में अगर उनका लो मसल टोन नहीं है या उतना ज्यादा नहीं है और उन्होंने चलना फिरना भी सीख लिया है, तो क्या तब भी उनकी फिजियोथेरेपी रोज करानी चाहिए? तो मैम कहती है हाँ, कम से कम आधा घंटा उन्हें एक्सरसाइज करनी चाहिए, जिसके लिए उनकी लो मसल टोन के लिए, जैसा कि डॉक्टर ने पूछा कि लो मसल टोन के लिए रेगुलर एक्सरसाइज, कुछ खास तरह की एक्सरसाइज जैसे उनकी रीढ़ की हड्डी की एक्सरसाइज, पैरों की एक्सरसाइज, वो बाद में भी करते रहना चाहिए। थैंक यू।
Yeah. Jitendra, yeah, I have two questions. One is regarding the legal implications as far as your financial issues are concerned, related to nominees and over a period of time, who is the caretaker, what finance, how the family is going to handle. This is one thing. Other thing is related directly to the medical system, insurance plans. Is there any option for insurance plan? Do the insurance companies reject knowing that this is a genetic disorder? So how can we bypass that, or how we can achieve that insurance also, being a
Right.
genetic disorder, they tend to reject the insurance claim. So how to manage that?
Okay. First, I'll answer the insurance part. The rejection was till 2020 only. So 2020, there was a clear-cut mandate from the regulator to all insurance companies that you have to cover person with disability. And after a lot of hindrance and though, so from last year 2022, the companies start covering person with disabilities. Now, what the change it has brought? So the regulator mandated that either you cover it.
Sorry to interrupt. We doctors are not allowed to put genetic disorder in the case sheet, because if we write like that, they will not get the disability is different and the genetic disorders.
I agree. So there was this court case, Delhi High Court case. Okay, after that, all insurance companies were mandated to cover neuro development orders and, to my mind, genetic disorders also. Okay, there are more cases, in the court going on with respect to that. So after this mandate, and the regulator clearly told that either you come out with a specific product or you start covering within your existing health policies. So in a recently only, companies have come out a separate standard product for person with disabilities, and there are 21 disabilities covered in that product. All insurance companies have it today. The only thing is that it's a very limited product, so you have a maximum 5 lakh of coverage, not more than that. But now, if you go to any insurance company, they won't reject it, but they will divert you to that specific product and will say, that will cover your child within this product. So now insurance is very well coverable, not from the health insurance companies. So no companies can say no, and no rejection. If any companies reject it today, you can very well take them to the task, because they cannot reject any person with disability. So that's the status today. Every company has a product, be it PSU, private, every company has a product now. It's standard.
Great. Legal,
Okay.
financial,
Legal
nominee
issues.
system.
So legal issues are very, very important, because here we are talking about the law, what the law says. Okay, I'll just give you an example of, let's take the legal guardianship. Now, the parents are considered to be natural guardian till the child turns 18. In the eyes of law, once the child is an 18, is an adult, like you and me. So once we are 18, nobody can take a decision on our behalf. We are an adult. Similarly, for the child, even a Down syndrome child turns 18. In the eyes of law, he is an adult. Okay. Yes, he requires support decision making. Now, if you as a parent want to take decision on his behalf, you have to go to the court and take the authorization letter, which we call a legal guardianship certificate. Now, these are the legalities which parents will have to answer. Similarly, come with finances. Any property which is in the name of the child, who is going to take the decision on selling that property? The child can't take it. Okay. You have already disclosed that he is a Down syndrome child. He cannot decide on financial matters. Who decide? Under what authority? So he has to take the authority from the court. So like this, there will be legal issues which parents will have to address within their lifetime and post their lifetime. You, in your mind, you have thought, okay, my brother or somebody will take all these decisions, but he doesn't have an authority, legal authority, unless he get the legal guardianship certificate or certificate for managing all the financial affairs. So whichever way you decide, there are legal issues which you have to address, and those legal issues can only be addressed if you plan it early.
Okay, Hindi.
Yeah.
Both the insurance and legal.
Yeah. So सबसे आसान उदाहरण लीगल गार्डियनशिप का है. Okay. लॉ ये बोलता है कि पेरेंट्स नेचुरल गार्डियन है जब तक बच्चा 18 साल का नहीं हो जाता। मोमेंट 18 साल का हुआ वो एक एडल्ट है। जैसे हम 18 साल के हुए, हम अपना डिसीजन खुद ले सकते हैं। तो लॉ के अकॉर्डिंग वो अपना डिसीजन खुद ले सकता है। अब एज अ पेरेंट अगर आपको डिसीजन लेना है, उसके बिहाफ पे कोई पेपर साइन करना है, आपके पास अथॉरिटी होनी चाहिए लीगल लॉ के अकॉर्डिंग, और वो होता है लीगल गार्डियनशिप सर्टिफिकेट। ऐसे ही प्रॉपर्टी मैटर्स हो गए, फाइनेंशियल मैटर्स हो गए, आप जो फाइनेंसिस बच्चे के नाम पे छोड़ के जाओगे या कहीं और आप उसको रखते हो, वो कौन मैनेज करेगा? और जो पर्सन मैनेज करेगा उसके पास क्या लीगल अथॉरिटी है? क्योंकि एक एडल्ट के बिहाफ पे कोई दूसरा मैनेज नहीं कर सकता जब तक कोई लीगल अथॉरिटी ना हो। तो ऐसे बहुत सारे लीगल मैटर्स इश्यूज होंगे जो एड्रेस करने होंगे, क्योंकि अगर पेरेंट आज एड्रेस नहीं करते हैं तो ये मैटर्स जाके फिर कोर्ट में रिजॉल्व होते हैं, और कोई पेरेंट नहीं चाहता कि मैटर मेरा कोर्ट में जाए, क्योंकि ईयर्स लग जाते हैं। तो इसलिए बहुत जरूरी है कि लीगल इश्यूज लाइफ में बहुत जल्दी एड्रेस हो, और उसके लिए आपने प्रोविजन पहले से कर रखा हो।
Thank you. So, Dr. Nandita Shah. So you've been explaining about that 21 days programs and all. I just want precisely the specific concepts involved in your program.
Okay. So nutrition is one of the biggest, just because everyone doesn't know so much about it, but exercise in the form of swimming, yoga, whatever, so many different things we have. Then being out in nature, fresh air, sunshine, water. There's also mind, like we do exercises to, psychological exercises to grow the, if people have issues psychologically or anything like that, and sleep, rest at the right time, and then there's some education.
Okay. So I've attended few of these classes and all, and we leave maybe 2-3 months we follow all these and then we leave. Do you have any plans to sustain the whatever achievements you have made in these programs? Is it some regular revising classes will go on?
Right. So at Sharan, we have lots of programs that go on consistently. And what we advise is just join any one program. Many of them are free, some of them are paid. Just join any one program regularly every month or something to keep on track, because it's again about community. Just as this is a community and therefore it's thriving, we are also a community and therefore we thrive. So if they come back, just for 1 hour a month, they will be able to stay on track.
Online sessions?
Online also.
Thank you.
शरण में किस तरह के कोर्सेज या वो कराते हैं, इसके बारे में उन्होंने बताया, जिसमें वो न्यूट्रिशन, एक्सरसाइज एंड मानसिक अवस्था के ऊपर भी ध्यान देते हैं, उसको कैसे बेहतर बनाया जा सकता है। ये ऑनलाइन कोर्सेज हैं, अलग अलग तरह के कोर्सेज हैं, कुछ पेड हैं और कुछ फ्री हैं। इन्हें आप ऑनलाइन भी ज्वाइन करके देख सकते हैं और चूज कर सकते हैं कि कौन सा कोर्स आपके लिए फायदेमंद है।
Thank you. Ritika, what should I ask you? New moves, some new moves you're going to teach us?
You want to conclude with that?
Yes. Whatever you want to say. Stage is yours. Everybody's waiting for yours. I think your turn, I think. Okay.
Sure, why not? So yesterday we witnessed some fabulous performances here, right? So dance moves, not just physically, I think emotionally. The chief guest also said she had tears in her eyes, spiritually as well. And there are, some of you have come and asked me, we want to learn structured dance. What they do all kinds of freestyle very often. Saying it's okay to do freestyle because it allows them to just express themselves. And if you want to make it structured, you can start simply, right? And get them involved. The music can be the freestyle, hip hop, Bollywood music that they want, but you can slowly bring structure. But structured movements actually help a lot with how their entire balance, motor coordination, memory, and all of that improves. So anyway, they all said how generously that we're all here to support each other, right? And I think each one gives meaning to the other in our lives. So we will do the next one again, rising up from our seats, but holding hands to whoever is next to you. Doesn't matter. There's nobody stranger here, no stranger here. We'll hold hands. We'll hold hands as a community. We are here stronger, getting stronger every year. And we will do first 4 counts. Hands go up. 1, 2, 3, 4. Right, right, left. Hands down. 1, 2, 3, 4. Right, left, right. Now faster. Up, right, left, right, down, right, left, right, up, right, left, right, down, right, left, right. Last time up, right, left, right, down, right, left, right. Thank you. Thank you very much.
Thank you. Dr. Esther. So we all know the influence of art on the intellect of children. So if we tell them, the families, to start this art or art stations, we all start off, but again, it won't continue unless we have stipulated time. To imbibe this habit into their day-to-day practice, do you recommend few hours, few minutes of day, and what session they have to keep it for this particular event? So that is dedicated only to this.
That's a very interesting question because it depends on the family. If I tell you make art from 4 to 5, no, it doesn't work. For parents, for me, the art starts with play. Play with your child. Let your child experience the world. So currently, I look from very young ages, get your child exposed to fabrics, colors, textures, and play. Try it. Try it. I mean, she wants you to try. I want you all take whatever you have. I say peekaboo. See, nobody does it. So how can we start with art? See somebody there? Yes, I see you. Peekaboo. You know, start having fun. And you will see how your child responds. Now, that's the beginning of art for a relationship. Your child needs to the environment. Art has a connection with cognition because whatever we see has to be translated into a verb, into a noun, into an image. But if we don't give them that opportunity, it will never become a noun, a verb, or an image. When you go out in the community, look at the trees, the leaves, and pick them up. And the connection with the senses is very important for your child. The air we breathe, the floor we touch, the ground, everything. So if you have scent, just go around with the twig and say, wow, look at this line, you know, what do we make? Don't let your child simply say, follow me. Go here. Sit down. You create a minion. You know what's a minion? So from there on, you start in the home. When you cook, make simple home Play-Doh for your child with flour, oil, and some salt. And let the child form images. Have shadow play. And this afternoon, we are going to work with your children with those basic elements. Done. Once your children know what is a line, a dot. Now, every morning, most women put a dot. That's where the art starts. It all starts with a dot. Your column. Engage your children in what you do, the rangolis, everything. But don't tell your child, sit down, do this. Because having choices through art is the first connection to cognition. There is so much, and I relate to speech therapists, special educators, natural materials. The earth is full of opportunities, dance. Make photos of your child and relate to your child in dance. So relate to what your child does. When you know your child, what matters, you get insight into another world. Can your child speak? Make poetry. If your child can't speak, play with lines, with dots, with colors. There is so much. That's the cognitive part, the mind needs to be stimulated. Now, India is an amazingly stimulating country. Give the culture of your country to your child, and you will see that India can rise above the rest. But don't close your child's eyes for the world. So you are the link of your child to the community and to India. That's all I can say. Thank you.
Thank you. Thank you. Thing is, art, dance, or play or exercise, we cannot direct the child. Go do it. We have to do with them. It should be a family activity, whatever it may be. So there comes the change. Actually, they get involved and you get involved. Over a period of time, the whole family transforms mentally and physically into a better family. That is the idea here. Don't direct the child. You go with them, do with them. Okay?
अपने बच्चे के साथ खेलें, उसे कपड़ों के साथ छुपना खेलना सिखाएं, कपड़े के रंग और कपड़े के टेक्सचर को उसे महसूस करना सिखाएं। कोई भी वाक्य जब हम उसे बताते हैं वो नाउन वर्ब आदि में तो तब कन्वर्ट होगा ना जब हम उससे बात करेंगे। और हम उसको क्या कहते हैं, उठो बैठो ये करो ये नहीं करना, ये कहना छोड़ दीजिए। हमें उसके साथ समय बिताना होगा। आप जो भी कर रहे हैं उसमें उसे इन्वॉल्व करना होगा। कितना समय है, कितनी सारी चीजें हैं जो जिनमें आप अपने बच्चे को इन्वॉल्व करते हैं। आप सुबह उठ के बिंदी लगाती हैं, क्या कभी आपने अपने बच्चे के साथ उस मोमेंट को शेयर किया है? क्या आपने कभी उसे बताया है? उसमें कितनी सारी बातें हो सकती हैं जो हम एक बच्चे को बता सकते हैं कि मैं बिंदी लगा रही हूँ, मैं बिंदी क्यों लगा रही हूँ, हम इसे कैसे लगाएं, चलो बताओ आज कौन से रंग की लगाएं। तो इस तरह की चीजें हम अपने बच्चे के साथ कर सकते हैं। ये दुनिया बहुत सारे अजूबों और वस्तुओं से भरी पड़ी है। आप और आपके बच्चे इस दुनिया में हैं एक्सप्लोर करने के लिए। इसे छूइए, एक्सप्लोर करिए और आज के बाद अपने बच्चे को ये कहना छोड़ दीजिए कि ये करिए और ये ना करिए। अगर आपका बच्चा बोल सकता है तो ठीक है, अगर नहीं बोल सकता तो कुम्हार बनकर उसके साथ बर्तन बनाइए ना। ऐसी बहुत सारी चीजें हैं जो आप उसके साथ कर सकते हैं। थैंक यू।
Thank you. So now the floor is open for questions, and if you have any, we'll be happy to answer.
This is not a question, but I would like to share some of my observations regarding the legal capacity of children with intellectual challenges who cross the age of 18. See, we have great examples of Unnati, Devanshi and many others, and I'm sure हम में से जितने भी पेरेंट्स हैं हर कोई ये चाहते हैं कि हमारे बच्चे इंडिपेंडेंट हो। बराबर है? आप में से जितने भी बच्चे 18 साल के ऊपर हुए हैं उनमें से कितने लोगों ने वोटर आईडी कार्ड बनाया है? बना लिया ना? इसका मतलब क्या हुआ कि ये हमारे बच्चे भी दे आर रिकॉग्नाइज्ड बाय द कॉन्स्टिट्यूशन एज इंडिपेंडेंट सिटीजन्स। हैविंग सेड दैट, पहले कंफ्यूजन था कि हमारे बच्चों की कैपेसिटी है क्या समझने की, लेकिन बाद में ये भी देखा गया कि हमारी भी पूरी कैपेसिटी नहीं है। अगर मुझे कोई लीगल मैटर्स में जाना है तो मैं भी एडवोकेट्स की सलाह लेता हूँ, टैक्सेशन मैटर्स होंगे तो मैं चार्टर्ड अकाउंटेंट्स की सलाह लेता हूँ, ज़रूरत पड़ने पे मैं वकालतनामा भी साइन कर देता हूँ। राइट? सो आई एम ऑल्सो इंटरडिपेंडेंट ऑन वेरियस प्रोफेशनल्स। तो सॉरी टू डिफर विथ यू, बट हमारे बच्चों की 18 साल के बाद में लीगल कैपेसिटी है, which is recognized very clearly in the Rights of Persons with Disabilities Act.
सर अनिल सर, आप अपना सवाल पूछ लीजिए यहाँ पे, इससे इस पे हम फिर बाद में बात कर लेंगे।
था क्योंकि मुझे लगा कंफ्यूजन रहेगा लोगों के मन में।
जी, आप अपना सवाल पूछ लीजिए हमारे पैनल से, जो भी आपका सवाल।
गार्डियनशिप इज नॉट कंपल्सरी। सो मोर ओवर जो मेथडोलॉजी है आज हमारे देश में, हमारे बच्चे तो रुकने वाले नहीं है, वो तो बढ़ने वाले हैं कि गार्डियनशिप सर्टिफिकेट इश्यूएंस के और उसके इम्प्लीमेंटेशन विद डिफरेंट स्टेट एजेंसीज इंक्लूडिंग प्रॉपर्टी ट्रांसफर रजिस्ट्रार, बैंक्स एटसेट्रा, have a lot of hassles, lot of barriers, and हमारे देश ने इंक्लूजन की पॉलिसी अडॉप्ट की है। इसमें मुझे लगता है कि जहां तक पेरेंट्स को लगता है कि हमारे बच्चे इंडिपेंडेंट किए जा सकते हैं, उनका अधिकार है, संवैधानिक अधिकार है। जहां उनको सपोर्ट की जरूरत है, वहां पे जैसे आपने कहा था कि उनको सपोर्टिंग मैकेनिज्म्स देने की जरूरत है। मुझे इतना ही कहना था, बट इफ यू लाइक यू कैन।
Okay,
थैंक यू।
yes, yes.
Thanks, sir.
See, I'm not talking about ki every one has to take a legal guardianship. You know, you as a parent have to, think of ki what is the capacity of my child. Yes, a capacity of a child can be of independent living. He doesn't or she doesn't require a support for daily living or, anything else. Now, when it comes to financial matters or a property matters, if you feel your child is completely independent, she can decide, how to sell a property, how to manage finances. She can take a help of a financial advisor like you and me do. Very well, she doesn't require a, legal guardian, doesn't require. But if you think that your child does not have a capacity to take financial decisions, he or he might have a, capacity to live independently, but may not have a capacity to take financial decisions, then in that case, you might take a limited guardianship. The recent RPWD Act talked about limited guardianship, which says that with the consent of the person with disability, you can appoint a guardian. Now, if you are taking from National Trust, they will decide, or if you matter, if you take it from the court, the court also decided whether a limited guardianship should be given or a full guardianship should be given. When it comes to full guardianship, then you might have to, take that legal guardianship certificate without consent of the child. So it's totally up to you. You have to think of what is the capacity of my child. If he's or she is as good as you and me in taking decision on all the matters, then she is independent. Then you don't have to worry. She will live independent life. Okay. But if there is any decision where she won't be able to take it and she requires a support in decision making. See, I'm talking about support in decision making. There is a difference between support in personal affairs and support in financial affairs. For financial affairs, any support, you require a legal guardianship. Without that, you cannot do.
Yes.
Okay.
Yes.
But
got it.
yes, for
Is that
personal
the-
affairs, can.
Yeah, got it. We got the point. So the idea of this panel discussion is to create awareness regarding various aspects of managing a child with Down syndrome. So I hope we have
So one
given.
SOS announced. Amitabh Dash and Sharbani are waiting for the parents. If you are here, please go and attend. I think they need you. Thank you. Pradeep sir, to you.
Yeah. So the experts are available for you for specific questions in the afternoon session. So one question.
Yeah.
Maybe this will be the last question. Yeah.
Yes, you come forward, Panchali.
सर जैसा कि आपने कहा कि गार्जियनशिप, आई एम सिंगल पेरेंट एंड एवरी डे आई एम थिंकिंग कि मतलब मेरे जाने के बाद बेटे का क्या होगा, तो इस केसेस में, ऐसे केसेस में किसको गार्जियनशिप देना चाहिए?
राइट। सी, लीगल गार्डियनशिप जो हमने बात की वो भी पेरेंट के लिए बात की। हर पेरेंट को ये सोचना है कि आपके बाद कौन नेक्स्ट लीगल गार्डियन होगा, जिस भी मैटर्स में आप लीगल गार्डियन अपॉइंट करते हैं। अब कुछ तो वो पर्सन आप ही को आइडेंटिफाई करना है, राइट। प्रोविजंस इंस्टीट्यूशंस के होते हैं, नेशनल ट्रस्ट के पास प्रोविजन है कि एनजीओज अपॉइंट हो सकती हैं एज अ लीगल गार्डियन, बट आई थिंक उसमें बहुत ज़्यादा सक्सेस मिला नहीं है और एनजीओज आर ऑल्सो नॉट ready to take up legal guardianship because it's a huge matter, taking a legal guardianship for the lifelong matter. So legal guardian you can think of within family, or if within family is not available, you can always appoint a person outside family also. Okay, he or she can also become a legal guardian. The only thing is that he will also have to go and get the certificate from the court once that situation comes. No, by default, the law says that it is going to be the family member, either immediate or distant.
There is no support.
There is no support from family, then you can, look around, friend, or even from the community also you can appoint somebody. See, these are legal matters, okay? There is no straightforward or no answer to that. if the situation comes, the matter will go to the court. The court can decide whether that person to be appointed or not. Or if you go through national trust, the national trust will decide. But it's not a foundation that you have to depend on family members only. You can always appoint somebody else, friend circle, or even from the community also.
My son is minor, sir.
Okay,
So he's
no,
having yes.
sorry to interrupt. This one you can definitely take it in the afternoon session. You
Sure.
can meet him. So your one-on-one sessions can definitely it will help. So time to thank my wonderful panelists. Thank you so much. My sincere gratitude to you all. I hope the session was successful because of all of you. Thanks a lot. Thank you.
Yeah, we request the panelists to stay with us. We would want to present a small token of appreciation to all of you, specially crafted by our champs only. Abir, come. We have these two little champs doing the honors for us. Ratna, please help.
हमारे सेल्फ एडवोकेट्स ने ये खास इनके लिए बनाए हैं और हमारे बहुत ही हैंडसम मॉडरेटर डॉक्टर के लिए भी एक बार जोरदार तालियां हो जानी चाहिए. थैंक यू. Handsome doctor.
We missed one part, so I'll ask Shikha to come on stage. So we were talking about the palatal expansion thing. Shikha, are you there? Come on the stage. Please share your experience. So Abir is Shikha's son, and he had been undergoing palatal expansion for the last 3-4 months. There were many questions and apprehensions about how the process is taken and so I think as a parent, she can address all the queries very well. Shikha.
मंच पर आप देख रहे हैं अबीर और हमारे एक और सेल्फ एडवोकेट प्रशांत. ऐसे प्यारे लम्हे बहुत खूबसूरत है. बहुत बहुत धन्यवाद हमारे सभी पैनलिस्ट का. शिखा, yes.
Now we request our champs to also give the small token to our beautiful translator, Parul ma'am. And we request for a group photo.
Hello everyone, myself Shikha Bhargav and my son is Abir Bhargav. And yes, Dr. Nidhi ne hame advise kiya for the palatal expansion, which is very much needed for our kids, because ऐसा हमें पता है कि हमारे बच्चों का जो माउथ होता है, उसका जो पैलेट है, इट्स लाइक डोम शेप. तो उसमें टंग के लिए भी, माउथ के लिए, टंग के लिए पूरा स्पेस नहीं मिलता है. एंड स्पीच एज सच वी नो कि उसकी क्लियर नहीं है. तो एंड इट इज गुड कि अगर हम बच्चा जैसे ही 9 इयर्स होता है या मतलब 8 इयर्स के बाद से हम ये ट्राई कर सकते हैं, क्योंकि बच्चे छोटे होते हैं, मसल सॉफ्ट होती हैं, तो वो इजीली एक्सपेंड हो सकती हैं. तो इट विल डोंट टेक लॉट ऑफ टाइम, क्योंकि अभी वो कैसे सॉफ्ट मसल्स होते हैं, सॉफ्ट टिश्यूज होते हैं. येस, इट्स हार्ड, क्योंकि वो थोड़ा डिफिकल्ट लगता है जब हम देखते हैं अपने बच्चे को कि उसका एक्सपेंशन के लिए वो क्लिप लगाना है, तो उसको दर्द होगा, वो कैसे खाएगा, कैसे पिएगा. लेकिन सी मैटर ऑफ फैक्ट इट्स हार्डली फॉर 2 days. अगर हम एक्सेप्ट कर लेंगे एज अ पेरेंट, तो बच्चा तो एक्सेप्ट कर ही लेगा, क्योंकि उसके लिए इतना चैलेंजिंग तब होगा क्योंकि अगर हम उसको ये देंगे, शो करेंगे कि अरे मेरे बच्चे को दर्द हो रहा है, वो खाना कैसे खाएगा, वो दूध पानी जो भी है कैसे करेगा. एंड मेरे साथ ऐसा हुआ था कि एक दिन तो मुझे लगा कि मुझे छोड़ देना चाहिए, बट पेरेंट्स ने मुझे बोला कि नहीं नहीं हमें करना है. डॉक्टर निधि ने सपोर्ट किया एंड नाउ इट्स 4 months.
नाउ वी नीड
एंड अभी उसका हो गया है. अब मैं यहाँ से जाऊंगी तो उसका क्लिप हट जाएगा. आफ्टरवर्ड्स यू कैन सी उसका अभी एक्सपेंशन. एंड उसका एडवांटेज ये हुआ है कि उसकी स्पीच और क्लियर हुई है. ही ट्राई टू स्पीक मोर लॉन्ग सेंटेंसेस. और दूसरा इंपॉर्टेंट कि इसमें टंग अपने आप मूव करती है. तो जो हम कहते हैं ना कि बच्चों की टंग मूवमेंट नहीं होती, क्योंकि जब उसको क्लिप लगा है तो जब खाना उसको अटकेगा तो वो अपने आप हटाएगा. Okay, and if any query, you can ask me later. Thank you so much.
Yeah, you can consult Dr. Nidhi for that on one session. So thank you so much. As they say, there is no greater gift for any organization than a reliable team of experts. Thank you, panelists, and our moderator, Dr. Pradeep, for being the gift that keeps on giving. Can we have a round of applause for them? Thank you for the technical support for playing that music impromptu. So, dear Humsafers, the one-on-one session with all the specialists will be happening in the following halls. Please listen carefully. Specialist doctors, OM 1 hall and OM 3 and OM 4. And all the experts you just heard now, all our therapists, will be available on OM 2 hall. Fit parts will be area around outside the OM ballroom where it is currently on, there only. And Esther ma'am session will be in the main hall. I hope you are all got the information right. Thank you so much. And we break off for right now. Samik, we need your help. Please listen what Esther is to say. We still have 2 registration kit with us. Unnati Surana, self-advocate, and Swapnil Saikat. They are with me. If the champion parents are listening, please collect those registration kit from me.